All right, I want to welcome everybody to the family tree. Put your hands together, family. Come on, come on, come on, come on.
Yes,
hey,
sir.
hey.
Yes, sir.
Hopefully everybody's doing well and everybody looking good.
Yo,
oh,
man.
they got the Big B. They got their Wednesday faces on.
Yeah, man. Yes, sir, buddy.
Look at them. Everybody looking good.
Grinning like a big dog. Wow.
Getting ready to gather around the tree. All right, all right. All right, we're going to bring the music on down and we're going to get started today. Start to go into what's happening around the world.
Oh,
yes,
man.
yes. Before we do that, let's come off of share here. Can everybody see you? Can you
Yes,
see
sir,
yourself?
buddy. Yes,
All right,
sir. We
good.
got everybody, buddy.
I want to thank everyone for coming through to the family tree. This is the place where we say we come together, gather around this tree. We call it the ancient laurel trees.
Yeah, buddy.
We remember the ancient customs of when we gather around trees. We talked about situations, problems. We were like a tribe. We got around there and talked about problems. But guess what? We also prayed. And with that, that was our social security. You got to
That's right,
say
buddy.
it slow. Social
Security.
security. That means
Yes, sir,
it wasn't a check, it's your family.
Family.
That's right. So the biggest thing that you can lean on is the fact that, yeah, guess what? The solution to your problem may be around this tree. So with that, we invite you to the conversation about holistic health and all that's going on. So if you want to join the conversation, go down to your menu bar and you may see that little reaction where the little heart is.
Yeah,
Click
buddy.
that. Raise your hand like Big B up there.
Bam.
Big B, you got your hands up.
Bam, 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 bam.
About to get arrested.
All right.
Wow. Look out, big boy.
Put your hands up. It's starting up already, y'all. All right. Put your hands up and we'll get you into the conversation. If you're somebody says, hey, I don't want to, maybe I just had a question. I want to put it in the chat box. Put it down in the chat box and we'll get Big B because Prophetess is out today. But Big B will get that question for you. All right. And
Yes,
we'll
sir.
bring
Yes,
it
sir.
forward. If you're someone that's calling by phone and you may have missed the prompt that actually lets you know how to log in and ask a question or raise your hand, no worries. Just let us know that you're calling by phone and we'll get you in. All right. Hopefully everyone is doing well. Hey, if you are someone that's joined us for the very first time, welcome.
No.
We are also streaming on Facebook right now. Go to Dr. Paul Hopkins and you will find it on Facebook and we are live. So if you have someone that did not get the login information for Zoom, go there and you shall get in. Okay. All right. Big B, I want to give our host with the most, Big B, a hand. Big B. Come on, y'all. Let's give him a
Yo,
hand.
man, that's what's up, buddy. Yes, what's up, man?
Before we get started, what's going on, buddy?
Man, I'm drawing air, brother. I even went, look, even in a little bit of rain we got, I hugged my tree too. I got my
You
tree
hugging
hugged
your
in.
tree? You hugging the
Yeah,
tree
man, I
even if
got
it
my
was
tree in,
rain?
man. Yes, sir,
All right.
man.
All right, all right. So Big B, we've been watching the COVID thing, man. You know, because it's starting to strike up a little bit.
Yeah,
You're seeing
buddy.
it in different parts of the country.
Yep.
And the numbers are raising. So
Yep.
what is the latest numbers that you have from the CDC? Okay.
Yeah, man, you got our early indicators, man. Our test positivity again. I mean, it's starting to really kick, Dr. P. It was like what I was like 7.9 a week ago. It's up to 8.9%, man, for test positivity. So, guys, hey, make sure you got paying attention. Our emergency department visits, that's also gone up to. It was like in the point 0.5, 0.6 is up to 1.0 now, guys. Pay attention, pay attention. Our hospitalizations by the population, guys, 1.3%. That's also going up. And here's the big one right now, guys. The deaths right now are starting to creep up, guys.
Yeah.
It has now gone up to 0.4%.
Yeah,
That's the one we got to pay attention.
You got to
more than
pay
anything else.
attention to these
Yeah, man.
numbers, and these
Yeah, buddy.
numbers are numbers that we start to say, you know, keep an eye on this. They're not testing again people; they're testing through wastewater. So that's
Yes.
why these numbers are based on wastewater. Early indicators represent the portion of national COVID tests and emergency department visits. Wastewater information also provides early indicator as it spreads. So keep that in mind. All right. So we will stay on top of that. And yes, we're watching it all throughout the country. There are some things that are creeping up, but the most part, keep your hands, we say, clean when you're out and about. You know, that Feazol. We have a lot of things
buddy.
that we can do. We're going into eventually the fall's coming up fast, y'all. This summer's gone. This year,
Yeah, it
gone.
is. Doesn't exist anymore, man.
I was just saying to somebody
Gone.
today,
Lord.
the summer's
Thank the
gone.
Lord.
I'm
Thank
like,
the Lord.
Oh, you
Thank
mean
the
thank the
Lord.
Lord? He said
I
thank the
can't
Lord.
deal with the heat. I can't deal with the heat.
I got you, Mark. Okay, we're gonna get started, and of course, when we get started, I have I would say, the pleasure of actually opening up to the floor to those who have testimonies. We talk about testimonies because testimonies go a long way. Testimonies are what helps those that are going through something. Some people going in a storm, some people in a storm, some people coming out of a storm.
I know
No
that's
matter
right, man.
what, we need that information because that can help somebody through their midnight hours. So what we do, we open up the floor for the first time. If those that are calling for the first time, if you have a question, something that you want to share with the family that may have been a thing, a technique or something that you heard, or herb or something, you say, hey, guess what? This week my blood pressure got well. Or last week during the early part of the week, I heard you talk about that thing about inflammation. Tried it, and guess
Yeah, yeah,
what? It
yeah.
worked. Guess
Yes.
what? So whatever the situation is, we invite you to the conversation today. The floor is officially open. If anyone has a testimony they want to share with the family, the floor is open. Big B, the floor
Yes.
is open.
Yes, sir. All right, guys. Don't
I
don't don't don't
have
don't. don't.
a
Uh-oh, uh-oh,
testimony.
The voice is back.
I have a testimony that
All
I've
right,
been
there you
dealing
go.
with for a whole
Go ahead,
month.
buddy.
My daggone tooth got infected badly, and I was trying to get this thing resolved. I was on its way getting my tooth together. I found a surgeon that was able to do it. I made an appointment. Then they called me a week. No, they called me half of the week, and they were saying, "Mr. Kinsey, we have um, Aetna for your insurance, and you don't have that." I said, "Yes, I have Highmark." "Well, we're not in your system, and we're gonna have to cancel your appointment." I said, "Well, I can't. There's no way I can expedite this and give them my insurance." "No, I'm sorry. You're gonna have to cancel this." I said,
Mm,
"Well, our appointment's on Monday." I said, "My tooth is coming." I said, "No, no, no,
mm,
please don't do it." I said, "We're gonna have to cancel. Sorry." Click, click. I'm like, "Dad, these people hung up on me." So what I had to do, I had to call my insurance and find another person and this, that, and the third. I was going through changes, y'all.
mm,
So I kept oil pulling, and then I start using um golden seal and wormwood.
mm-hmm,
And I started using that, and it calmed it down because they were telling me you need to get some moxicillin. Well, the dentist gave me some moxicillin and some penicillin. I said, "I don't take those cillins. No, I don't do that."
mm-hmm,
I
mm-hmm.
told them that. So that's what I started doing, the wormwood and golden seal. And
Okay,
I was doing that for a while up until now, and I'm still doing it. And
okay.
I finally found, no, I went to my insurance. I was telling my, well, the last doctor was telling me, he said, "Well, look, I can't do it because you have MS and we don't have adequate uh, uh, stuff here for us to do this work because you had to be put to sleep. And if anything go
Mm,
wrong, it'd be best for you to go to Temple University. They will have
mm-hmm.
more, available, for your
Right,
situation." I said,
right.
"Okay." So I went home, called the insurance, and they working on it now for me to go to
Okay.
Temple. And I
All right.
can't wait. My
All
tooth
right.
is done.
All right. Well,
So
Mark,
does anybody ever
hopefully,
go through this? Does
well,
anybody go through this? Just start using wormwood and, keep oil
all
pulling, and
right.
that
Let's give
calm
Mark a
everything
hand. Let's
down.
give him a
That's
hand.
up,
Come
buddy.
on,
That's
y'all.
great,
Give him a
Mark.
hand,
Hey, look.
Mark.
Hey, at least you're working on it,
I
man.
can, I can
No
emphasize.
worries.
Congratulations.
Yes. I want to
I'm still
reemphasize that
working on
for
it.
you, Mark. When you're talking about packing the gum or packing the teeth, I had a situation earlier today. Same thing. What you want to do is pack the tooth. The wormwood is good. Also, black walnuts and the golden seal. Okay,
Let me
those are all good. Yep, you can actually take a little bit of, or the clove powder also, the clove. Okay, so actually all of it's in my parasite formula. Really, that's what's actually in this formula right here.
about to
You
break
can
that
actually,
formula.
yep, you could take this formula, Lily. You could take this formula, put a little paste, put a little on a plate, add a little water, make a paste out of it, pack it on, put it on like a cotton ball, and put it
Yep.
right in that area. Yep, it will
Hmm.
help with that area because this one has my parasite formula has the clove in it, it has the black walnut in it, it has also the wormwood in it. So it's all three in here, plus the garlic bulb and all the other things. So it keeps infections, but it's also anti-parasitic and it tightens the gum. So those things can help it in the process of healing from getting infections. So Yeah. Thanks, everybody. Appreciate you, man. Thank you so much. And Mark, keep up the good work. Also, oil pulling. You remember the oil pulling, right?
Yes, yes,
Okay,
yes,
keep the oil
yes.
pulling going because oil pulling does work.
Absolutely.
Oil pulling is used with sesame oil, right? Sesame oil,
Hmm.
unrefined sesame oils, about 2 to 3 tablespoons. How long are you doing? About 10, 15 minutes?
I was doing a half an hour.
Okay. Okay. Okay.
An
That's
hour.
good. Okay. Well,
And
you're
you
a
know what,
soldier.
Dr. Paul, I got one more thing. When I was
Hmm.
talking to the dentist, and I asked him, I said, "Do you know anything about oil pulling?" He said, "Oh, yes." He said, "Well, what do you use?" I said, "Sesame seed oil." He said, "You know what? It's best to use coconut oil. Try
Mm-mm.
coconut oil."
Coconut oil is better, but it's tastes better, but the
Hmm.
sesame is more effective. Yes.
Okay.
That's the reason
Okay.
why. Yeah.
I'll
Yeah.
still do it.
I always tell them
Sesame.
sesame kills staph and streptococcus bacteria on contact. And
Okay.
no other oil does it. That's why we call the sesame the queen of oils. So it
Good.
may taste better, but the most effective is sesame oil. Yeah. All right.
I'll
Thank you,
pay
Mark.
attention
Appreciate
to
you,
you.
buddy.
Yes.
All right.
Hmm.
Let's see. Anybody else have a testimony want to bring to the forefront? And we want to give you a shout out for. Could have been
I
anything, y'all.
I have a
Clarify.
testimony.
All
Oh,
right,
go ahead.
Patricia.
Oh,
Go
Yes.
ahead,
hello, I'm
Patricia.
sorry.
Uh-huh.
Good evening, everyone.
Good
Good evening.
evening.
Hey, Patricia.
Thanks, God.
Hey, how's everybody?
Just
Good,
wonderful.
good.
Just wonderful. Go
Good.
ahead.
So I have a testimony about the young lady that I told you about a couple of months ago had stage 4 cancer.
Right.
Yes, yes.
And I brought the NGB for her. She
Hmm.
lost it, then she found it. So she started taking it. And then I talked to her the other day, and she said that she started to feel much better. She said she had stopped for a couple of days just to see how she felt. She felt, oh no, I got to get back on it.
Mm.
So
Mm-hmm.
she's
Mm-hmm.
doing so much better, Dr. Paul. I
All
want to
Amen.
tell you
All
that.
right.
right.
That's great to
All
hear,
right.
Patricia.
Let's give her a hand.
Indeed,
Let's
indeed,
give her
indeed. That's what's
what's her
up.
name? What's
What's
her
your
name?
name?
Gwen.
All
Gwen?
right,
Hey,
shout out
Gwen.
to Gwen. Shout out to Gwen. Everybody
Yes.
come off mute for Gwen. Come off
Congratulations.
mute for
Yay,
What a
Gwen.
Gwen.
blessing. What a blessing.
Woo.
Amen.
Yes,
Awesome,
thank
awesome.
you.
Absolutely. And Patricia, we're going
God
to
bless
shout
you,
out to
Gwen.
you too for being the
Thank,
ambassador of
there
health
we
over
go.
there. You keeping things in check, and hey, just by you showing up, bringing that to her helps her. And even when she lost it, you helped to get it back again,
Well,
right?
Right,
The devil is a lie.
right, right. That's
well,
what I said.
that's right. That's
He
exactly right,
busted.
man.
That's
Yep,
So,
right.
yep.
Dr.
So
Paul, I
yes.
have something else to ask you.
Hmm.
What
Sure.
can you give children under 12 to cleanse? How do they cleanse? What do you
Well,
give them?
children are already pretty cleansed. Because they just got here. So a lot of what they need is just to keep them away from the extra salt, the extra sugar, the refined sugar, refined salt, and the oils and the dyes, all those things that are found in a lot of the candies and the cakes, the cookies, the pies and things. And when you try to keep them cleansed, we usually just give them the syrups, like the elderberry. We say not to diagnose street kill of any disease, just food for the soul. Things like the elderberry syrup. And sometimes you
Okay.
can find the elderberry in ways of like honey. You can find elderberry honey, things like that. We give them to help them get a long way. It helps the digestive system. So that means keeps them away from a lot of the viruses because a lot of them are feely touchy. So they
Hmm.
let them
Mm-hmm.
put their hands in their mouths, things like that, and they transfer bacteria that way. And then they start to get the stomach issues and the stomach pains. So, or the diarrhea. When you start to see children with diarrhea, that's bacteria in the gut or virus in the gut. So that's why we use the elderberry syrup. The best of the elderberry would be from Israel. Okay, it's
Okay.
black elderberry, right? From Israel would be your best one. Sambucus, that's what they call it, sambucus.
Okay. Hmm.
All right, so if you can get those, you can find it in most stores. Yep, but that's what we
Okay.
would give them. Okay.
Okay. And I have one more, another question. A person who's schizophrenic,
Mm-hmm.
is there anything, I know that's more spiritual or that's more like I
Yeah,
don't know.
they would have to be evaluated because there's a
Okay.
lot that goes with that. There's a lot of levels, spirit, mind, and body that goes on. We have to look at their past. We got to look and evaluate everything before you can even move forward with that. You got to see are they on medication? Are they being ministered any psychotropics? There's a lot going on with that. They need an assessment. Are they in the Philadelphia area?
Yes, they are.
Okay, I would just say give them, link them up with the number, give them my number, and we can, set her up for an appointment or him up with appointment, and they come on in and we evaluate the situation. Okay.
Okay.
But make
Okay.
sure the fundamental principles, what you could be helping right now is the fundamental principles that we talk about on this platform, which is the water, the
Mm-hmm.
green drink, the things like balancing the pH, staying off the top 10 toxic foods that we talk about. Those are the
Right.
things that you can reinforce right now until they get an assessment. Okay.
Okay. And I have one more question.
Okay.
What can you take when you have to get a mammogram or x-rays? What can you take before that? I was told liquid chlorophyll to try to, I mean, it's not
Well,
gonna,
well,
I don't
that's
know what
that's one of the
Mhm.
things that you can take, but usually what you want to do is cleanse the lymphatic system. Whenever you're
Okay.
looking for a mammogram, you want to cleanse the lymphatic system because that's what's causing a lot of the breast cancer that's happening is a lot of blockage in the lymphatic system. So we try to move the lymphatic system. So any of the lymphatic detox things that we talk about on the platform,
Mhm.
those are the things that you want to do. It's a detox in
Okay.
order, but also it's staying away from the bad food, back to the top 10 toxic foods again. Those are the things that are happening. Water is the biggest. Okay. The
Right.
biggest swing is water. If you don't get the water, you can't flush nothing out. So keep that in mind. Okay.
Okay.
All
Thank
right.
you.
Thank you. Appreciate you,
All right,
Patricia.
Patricia.
Appreciate you
Congratulations. Keep
too.
up the good
Thank
job.
you.
All right. Keep up the good
Th-
job. All right. As
Thank
we
you.
let more folks in, come on in, family. Come on in. Come on in. Come on in. All right. Big B, we have anybody else? Was that
Anybody else got
Cliff,
it with a
Cliff got one.
testimony?
I got one.
Okay,
Cliff.
who's that? Hey, Cliff. Hey,
What's
go
up,
ahead, buddy.
Cliff? What's going on, Cliff?
Hey, just want to share. We got to see Dr. Paul last Thursday, my wife and I, and just to share with you, Dr. Paul, you kind of took that RM3A, man. That thing is deep. And just to share, my wife, she was struggling with blood sugar issues, and she's been going to the doc, and they've been trying to put her on more meds. She was on glyperamide, I think, the last one, and they try to give her blood pressure medication, HTCZ, HT,
Mm.
whatever it is.
ACTZ,
And
right?
what happened, you
Mm.
kind of looked at the cause of the problem, and we went Thursday. Well, Saturday, she had swelling that went down. She had swelling in her ankles because of the meds. And then this normally her sugars about 200, 220, something like that.
Hmm.
Well, this morning she came, she says, "Oh, my sugar's 127."
Look out now. Look
What?
out
Look
now.
out now.
Look
Look
out
out
now.
now.
Well,
Come
smack,
Amen.
on
smack,
now.
smack
Yes,
her for me, Cliff.
Amen.
Give her a
Come
big
on
hug.
yeah,
now.
What are you talking
Amen.
about?
Come on now.
That's what's up.
yeah.
Amen.
And you helped us
Yes.
to, basically, if recommended far as we tell on the platform about the red onion tea. So you suggested about drinking it all day in a little pot. We did that. And
Yes.
as well as adjusting our water. That was the main thing we did. Oh God, it's remarkable. And she's feeling so much better. And I really thank you for, just
Oh man,
Yeah,
helping us.
let's
man.
give
See,
we
that's what's
gotta
up.
give Cliff a
That's
hand.
wonderful.
Cliff, oh man, that
Great.
is
Amen.
awesome. I'm
Great.
so glad to hear that. Leolar, is it Leolar?
Yes.
Congratulations.
Yeah.
Leolar,
Leo's a quick.
Good job,
Yes.
Cliff.
yes, give her a shout
Thank
out.
you. Thank
Yes,
you.
Everybody come
indeed.
off
Congratulations.
mute for
Give
Cliff
her a
and
shout out,
Leolar.
give her a hug, give her
Yeah.
everything, Cliff.
Yes.
Our
Yes.
God is
Yes.
awesome.
Yeah,
Good.
man.
Yes,
That's what's
that
up.
is
See?
That's
awesome.
All
wonderful.
right.
Awesome.
Hallelujah. Glory,
See,
glory, glory.
Hey,
boy, you
y'all,
can't tell
it
me,
is
man.
possible. It's very real. It's
Ooh, yeah,
very real.
buddy.
It's very possible.
Yes, sir. Yes,
You got
sir.
to walk, we say not walk in fear, but you walk in understanding and
Understanding,
knowledge and
yes.
understanding and wisdom. And then you don't break the principles. We've been breaking the rules. We've been doing the wrong things. We've been exposed to the wrong things. Yet we have not been taught. So I'm gonna let us all off the hook that we haven't been taught correctly. And that's
Okay,
where
there you
we
go.
have to start to get back into each one teach one. So the things that we learn here on this platform or the holistic things, those little things make a difference. And we learn quicker and faster when we hear it in a setting like this. So thank you, Cliff. I
Amen.
appreciate you, buddy. Appreciate you, man. I'm so glad because when people worry about it, I said, don't worry about it. It'll be good. Just follow the rules. Follow that thing. Don't break the rules. All right. So good stuff. Good stuff. All right, Big B, who else we got there, buddy?
Anybody else? Talk
Yeah,
to me. Don't be. Go ahead, Karen. Go ahead, buddy.
yeah. I'll give a testimony. It's for someone else, a friend of mine I spoke to, and I just had to text her to get the details again from when I spoke to her last week. But
Okay.
good evening, everyone. Yeah, I have a friend down here. She was telling me that she went to a cardiologist for an appointment,
Mm-hmm.
and normally when she goes, her levels are all high. Uh, blood pressure levels and whatnot.
Mm-hmm.
But and Dr. Paul, like you say, always go in, sit a while, because you're rushing in and all this.
Yeah.
But what she did one time is she grounded herself. She stood barefoot in the grass and then went in for her appointment, and her whole readings changed. She said,
What?
she said normally
See?
her readings are out of whack due to rushing, driving, white coat syndrome, whatever the reasons. But when she stood barefoot in the grass and grounded herself, her levels
Plummeted.
all came
Man.
down when she went in. So I said, you know
Wow.
what? That's a testimony I'm going to tell on my next
Absolutely.
Yes, sir, man.
Absolutely. Let's give her a
Yes,
shout.
that
What's
is
her
exactly
name?
right.
What's her name? We're going to put her name out in the universe. What's that?
Her name is Maria
Maria?
Cephas, and she's from
Amen.
Westchester,
Maria.
Philly, up in there, but lives down here.
Okay. Actually, what's her last name? Maria what?
Cephas.
Cephas. All right. Well,
Cephas.
Cephas.
Okay.
All right, Cephas. Maria, we say congratulations. And
Indeed,
also
indeed.
to you, Karam, thank you, brother, for being the
man. Being
ambassador on the
ambassador,
floor.
as
Let's give
always.
them both a hand, y'all.
Yeah,
Come
buddy.
on.
Yes.
Come on, come on, come on, come
That's what
on,
you
come
gotta
on.
do, fam.
Congratulations.
Yes, yes, yes,
That is
yes.
That's
Yeah,
awesome.
buddy. Yes, sir, man. See,
That's awesome. That's
you got to
awesome.
do it, Dr. P.
Hey, man, you know what? These
Each one reach
testimonies,
one.
these
Awesome.
testimonies are real, y'all. These are real. We see it all the
is.
time on our side. Big B and I hear the stories. We get the emails. We get the texts. You
Yeah,
know,
buddy.
that's why we want to set this moment for testimonies so important so everybody can hear it. Because when
Yes,
we hear it, it's kind of like, you know, y'all supposed to hear it. Y'all supposed to hear it. Oh, you're supposed to see that, Doc. You know, Big B, y'all talk about health all the time. But when you hear it from the folks itself, this is what makes the difference.
Yeah,
So
from
stay
the
on
horse's
point.
mouth.
You
All
can
day
get
long,
through
man.
it. Don't worry about it. Just take your time. We say slow and steady, right? Slow and steady. That's what you want to do. All right. Who else we got there, Big B?
Okay.
I have a testimony.
All right. Come on through.
Okay.
So I have there's a coworker of mine at work
And
who I was
who's
That's
that
Summer.
speaking?
Doc-
Who is
that's
that?
Summer,
Summer.
Dr. P.
Hey,
That's
Summer. How you
Summer.
doing?
Hey, how are you guys doing?
That's right. Wonderful.
I have a coworker at work. I was sitting talking to her, and she was telling me that she's been having problems with her knee, and she had already had a surgery on this knee, and it wasn't getting any better. Sometimes it was so painful she couldn't even walk. And she had been back to the doctors, and the doctor, you know, she basically said, this, you know, whatever you did is not working. And his response was, well, we can go in and do more surgery. And I told her, yeah. And I said, do not let this man go in and do more surgery. And I said, first of all, I talked to her about a water. I said, how much water do you drink? I said, you can't expect your joints to move if they're not lubricated. I said, you have to drink water. And I said, she said, some of the pain is so bad. So I told her to try arnica. I said, get some arnica and try arnica. Well, about a week afterwards, she called me up and she was just over the moon. She said, Summer, I have not been able to walk this far. And she says, I can't even tell you how many months it's been. She says, the swelling has gone down. She said, it's not completely healed. She said, but the swelling has gone down considerably to the point where I can't even believe how much better I feel. And I said, and you were about to have surgery again. And she told me today, no, she told me this about hers about a week or so ago. Well, today I saw her in the hallway and she comes running up to me and she says,
Running up to you.
running up to me.
I heard that. I heard
running up
that.
to me. And she said her sister had called her the other day and was telling her, she said, I didn't even know my sister was having these problems with her ankle and her foot. And that she couldn't, her feet and her ankles were so swollen. Something happened. I don't know if she fell or did something, but she has been in pain for like the past 3 weeks with swelling and the whole nine. She's taken Motrin. She's taken Advil and Motrin are the same thing, but everything that you could possibly imagine. Nothing has gotten better, improved it. And she told her to take arnica. She said, I told my sister to take arnica. Well, she showed me her sister's text, and she said her sister was like, oh my God, this is a miracle drug. This is a miracle cure. She says, I have not been able to stand on this foot for the past couple of weeks. And I am now able to stand and walk on my feet. She said, the swelling has gone down considerably.
Amen.
And she was
See?
like, thank you so much for telling me. She said, because I was about to get surgery. And I said, there's other options. I said, you probably should see a chiropractor. I said, you probably should see a bunch of other people. I told her about you, Dr. Paul, and gave your information. So she may reach out. You know, you can only tell people, it's up to them to do what they want to do with the
That's right.
information.
That's
But
right.
I just was like, I had to, you know, do a testimony about it because she was just ecstatic.
Yes, and let's give Summer
Glad
a
to
hand.
you.
I know that's
Everybody
right.
come off mute. Come off mute.
Yeah, buddy, that's for
Glad.
real, y'all.
Teach some.
Yes,
Yes,
Awesome.
indeed.
God got
Awesome.
you.
Beautiful.
Awesome.
Fabulous.
Oh,
Great job.
And
Yes.
listen, was this arnica topically or she's taking it? Was she rubbing it on the affected area or?
She is. She had the topic arnica, and I also told her to get the homeopathic arnica as well.
Okay.
Mm-hmm.
It
Yeah.
comes in those little tubes. I told her to get that and then to take it topically. And she said the topic is what she rubs on, and the pain, she said within like a half an hour, the pain is like considerably, like she said, like 90% gone.
Mm-hmm.
So,
Yeah.
Amen.
Yep. Now, just keep in mind what arnica is. You know, arnica is an anti-inflammatory. It's a high anti-inflammatory, and it's an alkaloid. Now, here's this thing called. Y'all remember when I talked to y'all about this thing called doctrine of signatures? Anybody remember what doctrine of signatures is? What does that mean? When
When it
anybody
looks
hear
like
that?
what God made, like the walnut looks like the brain.
Like a brain, yes.
Right.
That's it.
Whatever it looks like is
Right.
what is good is what is good for. Got it?
Right,
So,
Kamar.
so if you look at the arnica flower, it is actually from the sunflower family. And guess what it's doing all day? It's doing like this. It's absorbing all that sun. So that means if it absorbs all the sun, if anything absorbs a lot of sunlight, what does it mean that it's good for? It's resistant to heat. Got it? So that means it's an anti-inflammatory. So when you put that, whether the sunflower or things that are like the aloe plant, all those things are high alkaloids. You put that on the areas of the skin, it penetrates right into the skin, and guess what? Anti-inflammatory, it reduces the inflammation. But it goes back to telling you what? It's all about the acid. Got it? It's all about that pH. It's about that pH every time. When you start to get your water right, raise that pH, guess what? The body says, well, I don't have to go after that knee no more. I don't have to go after your hip no more. I don't have to go after your shoulder or your back. So it's all about the pH. If you start to test your pH, you'll know where you are at all time. So no matter what you put on your body, those arnica, the pine, all those different things are alkaloids. They're going to always reduce that inflammation. So thank you so much, Summer, for bringing that information to us, to the family.
One question, Dr. Paul.
Sure.
What was that ingredient or herb that you said if you put it on before another one, it'll absorb it more deeply or faster?
Yeah, DMSO.
DMSO. Okay.
DMSO.
Okay.
But you can also, now, what also pushes that in is castor oil. Castor oil does also the same thing. It has the rhizoleic acid is like everything you put on top of it. The castor oil you put on top of it pushes it right on in. So it's either DMSO or castor oil.
Okay.
Okay.
All right.
Good stuff. Good stuff. Congratulations over there. What was your friend's name? What was your friend again? We can give her a shout. Karen. Shout out to Karen. Shout out to Karen. Keep up the good work.
Hey, Summer, invite her right here every Wednesday night. That way she'll stay healthier.
Yeah.
I did tell her. I did give her the info. So it's up to her to join.
All right.
Good stuff. Good stuff. Good stuff. All right. What do we have? Anybody else? Who else we have here? Big B. Anybody else got a testimony?
Can I do one more?
Do that. Mark, is you.
Just want to make sure before we do, Mark, make sure anybody else hasn't had the opportunity. Okay. Anybody else have an opportunity, because we want to go around, make sure everybody's got a first time chance. Okay. Anybody else have a testimony? Anybody else? Okay, Mark, go ahead.
All right. I was doing my blood pressure reading on my left arm, and it was kind of like 150. I can't remember, 150 over something.
Mm-hmm.
And then what I did, I used the other arm, and that was like, what was it, 120
Hmm.
over 80. Now, what's the difference between the right or the left?
Well,
If one is
it's
right.
yeah, it has a lot to do with your circulation, Mark.
Mm-hmm.
Hmm.
Your heart and circulation. The endothelial disruption could be on one side versus the other side. Where the vessels are a lot smaller. That's the whole purpose of, you remember when I tell you, when you walk, make sure you walk with both sides in
Hmm.
balance. Got it? Because if you
Hmm.
start to favor one side, you could be causing an imbalance of also the circulation system. You got it? So just keep that in
Hmm.
mind. But it can be sometimes you'll take the left or the right. Some people can see it's very prominent with some people, but then some people there's no difference. I would say test both sides when you're doing it. If you notice the difference, test both sides. Also, make sure you're plenty rested before you do it. Don't do it after you've been running
Hmm.
around. Always wait 15, 20 minutes. This is for everybody. When you're taking
Hmm.
your pressure, make sure you sit and rest. Don't get up and move around and then try to take your blood pressure. Got it? At a resting state. I was part of the original uh, blood pressure testing that took place back in the years around 2000, 2003. And we took all the data. And when we were doing the data and research around the country, one of the biggest problems that we saw was that when we were taking people's pressure, we were taking it and the difference between resting and active. So resting would be when you're resting about 15 minutes. Active is actually when you just move around and you sat down. When we test people when they were active, their pressures were up 30 to 40 points. Do y'all hear that? 30 to
Mm-hmm.
Wow.
40 points. But when we took it at a resting state, it went back down to that, less than 30 and 40 points. So it means that you want to always get your pressure at the resting state, not an active. Got it? So always
Mm-hmm.
It's
rest.
the top or the bottom number that change or both.
Both of them would change. Yep.
Hmm.
We were seeing both changes in both numbers. So it can be an inaccurate number because your body's adjusting to the moving around. So if anybody take your pressure as soon as you go to your doctors, make sure you rest before you get up from the waiting room and go into the main office. When you sit down, they want to take your pressure. Don't take it. Wait about 15 minutes. Tell them to come back and take it twice. That's what you do. Got it? Keep that in mind. All right, good stuff, Mark. Just stay on top
Okay.
of it. Just keep a track on left and right side. That's what I would
Yes,
do.
sir. Yes,
Hmm.
sir.
All
All
right,
right.
y'all. Let's see what else we got here. Big B.
Anybody else? Anybody
Anybody
else?
else? How about the chat box in there?
That's what I'm looking
Anybody?
at right now. As a matter of
Okay.
fact, there were a couple. Let me go down to the bottom. That were on, excuse
Okay.
me, on Facebook.
Okay.
One of them had to from, I think it was
So we'll
Andrea.
go
Yeah,
into the questions then. We'll go
yeah,
into the questions now. Okay,
yeah.
go into questions.
Andrea
Okay.
said, "Hello. I normally wear New Balance sneakers, Dr. Paul, but wore sandals the other day. Since then, I've had tingling sensation in my right calf when I walk. What could this possibly be attributed to?"
Well, you got to check the shoes. Definitely. You got to check the shoes.
That's Drea. That's
Yep.
Andrea. That's Drea.
Yep. I would definitely check the shoes. Sometimes you'll see the shoes, and y'all, I'm gonna tell y'all, watch getting the shoes on sale.
Yeah, man. Yeah,
Because
indeed.
sometimes it's really close, but sometimes when you get the shoes on sale, they may be a little irregular on one side versus the
Mhm.
other. And people don't realize it, but it is a small irregular there somewhere, and it can cause your hip problem. Your hip can go out of place or be moving in the wrong, landing in the wrong place. So check your shoes, okay? Check your shoes and make sure that they're level, they're proper level. Sometimes you may need a little extra support in that shoe in areas where the instep is located, or
Mhm.
sometimes it would be in the heel versus the toe. Some shoes don't fit perfect for everybody, so I would get an evaluation. You can get, now Dr. Lenny got a great machine. I don't know if y'all have actually been a participant. If she's in Philadelphia or in the area, I'm sure everybody has a lot of this. No matter where you are, you can get this machine. They can evaluate your feet. Okay, you can evaluate your
Mhm.
feet. Put your feet on this on this scanner. It scans your feet and it can tell you exactly what's needed for you. So if you decide to wear sandals, they'll say these are the insoles that you're going to have to use, or something that you would help you give you extra support. Okay.
Dr. Paul,
Yes.
Yes,
I have a
Dr. Linda.
comment about that. Because I had bought some Nikes. They were probably, and I bought
a men's Nike because it was wide enough, had a larger toe box. The
Mm-hmm.
best pair of sneakers I ever, I mean, I literally wore those sneakers until they fell apart. So when I went back to where I got them and I went to buy some more, and I noticed over a period of time I was getting that very similar pain in my shin. So I
Yeah.
went to see my foot doctor, who sent me to Fleet Feet, and they put me on that thing, and I ended up getting a pair of Brooks.
Mm.
$173. I could have got them online cheaper. But
Ooh.
then I went to my orthopedist, who showed me online where you can buy it's an insert called Super Feet.
Mm-hmm.
Mm-hmm.
You can get
Mm-hmm.
the Super Feet that has a good arch support, and using the Super Feet, and I pulled the cushion out of my Brooks and put the Super Feet in there. Within a week or two, that pain was gone.
There you go. Yeah, that's
Okay.
right.
Okay.
So I would say thank you, Dr. Miranda. Appreciate you. That's excellent information because that's
And the Super
exactly.
Feet are cheap because they're like $50 a pair. So
Mm-hmm.
it would be worth it to give it a shot and see how it works. And if it doesn't work, then go a little further.
Mm-hmm.
Right.
Super
Mm-hmm.
feet insoles, is that what it's called?
Yeah.
Okay, so maybe we can grab that on the website.
So do they
Superfeet.com.
adjust to your
Yeah.
feet?
Superfeet.com.
They
Huh?
adjust to your feet. You don't have to be measured for it.
No, they
Like
come, you can
instep and
trim them. You can trim them according to the shoes
To
that
the
you're
shoe
wearing.
care.
So
you
I
Yeah.
can
have a pair
size.
for my casual shoes, and I have a couple of pairs for my athletic shoes.
Mm-hmm.
Okay, so it's more the size than like you know how some people walk is sub what they call it, the feet turn in or out.
They
That doesn't matter.
supinate and pronate.
Yeah.
Yeah.
Mm-hmm. Mm-hmm.
Yeah.
Mm-hmm. Yep. So yeah, because we can look at your feet and tell if your hip is out of alignment. Do y'all
Mm.
know that? You can look at your feet and see if your hip is out. You ever, if you're laying flat on your back, right? Can y'all see me right here? Y'all can see
Mm-hmm.
me,
I can
right?
see. Yep.
And if your feet are like this, right? And if you just let it go, and if one leg go like this,
There you go.
one leg like that, and the other one go like that, your hip's out.
Yep.
Your hip is out.
Because
Your
they
hip
won't
is out.
drop. They won't listen,
They
guys.
won't
They won't
drop.
drop
Yep.
one way or the other.
If you got one, because sometimes you'll see one go this way and the other one stays up, that hip is out. You got it? So that's where we can measure, and there's an evaluation where we look at your shoes and we can tell what's going on with your hip based on the part of your soles that are wearing out. So if one side on this side is wearing out, we can tell you that it's causing other things going on with your body. So I'll see if I can pull that chart up. Y'all want to see that chart?
Yeah,
Let me
that
see
would
if
be
I can
nice.
pull that chart. That would
Hey,
be
that's Dr. Paul, while you're looking for
Yeah.
Hey, ladies, let me share this with you. Manufacturers are after you guys more than they are the men. Listen, they market things to you for your feet that make your toes turn in. They always give guys plenty of space. Going to Dr. Clarinda's point, they give you plenty of room for width. But for women, they turn your toes in.
Yeah.
That's where you end up having a
And
big
then the
knot,
weight.
big knot on the inside of your shoes. Okay.
Yeah.
And that really messes with your alignment in your body and just your health altogether. So be careful.
Yeah. Yeah.
It's
Also,
all vanity.
Yeah,
Yep,
amen.
it's all
That's
vanity.
exactly
You
it.
got it. So what's happening? It messes with the causes bunions.
Yes,
Because
my
now when
point.
it crams the foot into that area and your weight is pressing on and you're moving forward, it actually causes problems moving forward. Every step you take pushes into that foot and actually causes bunions, which can be very bad for the entire posture of the body. So keep that in mind. All right. Good stuff, though. Good stuff. Superfeet.com. That's what it looks like. Superfeet.com. If you want to grab that and get yourself scanned, if you have somewhere that scans it, Dr. Lenny does it here in Philly. I have a pair. I have a couple of pairs of insoles from him, and I tell you, I put it in all my shoes, my sneakers, everything, and it really does increase the instep. If you have a flat foot or if it's flattening on one side versus the other, it really helps really well. So I would definitely say make sure you do that. Okay. All right. Okay. Let's
All
go.
right,
Who you got, Big B? Who
All right,
else
Dr.
next?
Creed, that was a question about the I think it was the arnica. The one of the spelling of arnica is ARNICA.
Yep,
Okay?
that is correct.
Arnica, ARNICA. Okay.
Yep, that's
Now,
correct.
for Irene Follow on Facebook, what can I take for severe arthritis, Dr. Paul?
Well, we just talking about it. That's
Well,
it. Arnica, that's it.
well.
Yes, yes, that's it. Make sure your water's right. You got to, it's all about the pH. See, everything we're talking about, that vicious cycle, this causes this causes that, this is called this is called this. They call it a vicious cycle because one problem's causing the other problem. But guess what the main problem is? You got too much acid.
There
You
you
got to
go.
make sure you reduce your acid intake. That means the body spins in a state of tearing down, where your body's on fire. Literally, the body's on fire. So when you watch the food that you're eating, it has everything to do with it. Only life begets life. So if you eat dead, guess what? Yeah, you don't want to
You're
eat
gonna be
dead because you're
dead.
gonna be
You
dead.
be
That's right.
dead.
Don't do that. So arnica cream would be excellent for that. But also, watching your diet. It's you got to put the fire out by what you're eating. Don't eat the foods that are causing the inflammation. Top 10 toxic foods. I can't tell you enough. That's it. Top 10 toxic foods.
Okay.
All right.
All right, Dr. Reed. Vaughn says, I have a family member and friend who are allergic to organic fruit. What could that be from?
I would say before you determine or you think that it may be organic,
There
I
you
would
go.
say it's
Yeah,
not
but
organic. You got to be absolutely sure. It's
sure.
probably the sprays they putting on it.
Yes.
That's what it is. Because yes, they spray even organics. Absolutely. And people are saying they're allergic, but it's not the allergic. They're really allergic to that spray. This is one called chlorpyrifos that they're spraying on it, and that is causing a lot of allergic reactions. And it is getting cross-contaminated from conventional into organic. So before you evaluate that, you got to make sure you're dealing with a clear and concise study that actually shows that it's organic. Most of the time, it's some modification that's going on. Sometimes it's the seed also. It depends on what specific organic food it is. Sometimes it's the genetic modifications of the seed.
Mm-hmm.
They are modifying the seed. You can't get seeds in lemons no more and limes,
Yeah,
y'all.
that's true.
Got that? Yeah, it's getting real weird out here, man. You can't get a good, fruit with seeds anymore. Everything's been pulled out. So be careful.
Like you
Okay.
said, it's
I
getting
got a
weird.
place where you can get seeds with lemon in it.
They're out
I mean,
there. They're
lemon with
definitely
seeds
out
in
there.
it.
Yeah, you just got to pay
You have to
attention.
find
Yeah,
it.
you just
You
got to
have to
make sure.
find it.
Yep, you
Yes,
just got to
sir.
look at them. Yeah, they're out
All
there.
right, Dr. Paul, one
You
more.
know, Dr. Paul, I'm sorry.
That's all right. Go ahead. Go ahead,
Just
Go ahead, Netha.
Hey, Nitha.
realizing
Netha crept in. She was hiding in the cut. Hey, Netha.
I got family in and I was preparing and
That's all right.
late. But that statement, when you just sit and think about it, because when she said that someone's allergic to organic food, you just think about that for a minute. That and as my husband always say, back in the day, I mean, they call it organic, but that's all we ate.
Yeah.
So that means if
Yeah.
you're allergic to organic food, then you're allergic to food.
Food, period.
Yeah, you're allergic to life. Yeah,
Ain't
that's
that the
right.
truth?
Something else is going on. There's an allergic reaction that happens. It can usually only happen if there's something that's been sprayed on a lot of stuff. That's why whenever those studies, I love to ask those people when they bring out those studies. I say, "Can I see that study? Let me see that study." And when you see the study, make sure it's addressing the difference between conventional or organic, or it's nullified. You cannot say this is a complete study if you're not addressing the difference between conventional versus organic. You got it? So that's why they'll never address that. It's always tests that they're doing that really are favoring, conventional. That you got to watch that. You got to watch that because some of that stuff is planned, research and want to prove points. You got to watch that. Be careful. All right, be careful. Yeah. All right.
All right. Here's my last question before we go to Karen. Last question. This is from Rachel. Dr. Paul, is it necessary for newborns fresh from birth to get the vitamin K injection? Is it child negligence if parents refuse and did their research? How can infants obtain natural vitamin K through the mother while in the womb? Is it possible? Or they need a certain amount of nutrients after birth?
It's the mother.
The mother.
It's the mother. The mother is the immune system. Got it? The mother is the provider. Baby, even after baby's born, it's the
Yes.
mother. Got it? The mother is what's providing the nutrients. So whatever she eats, the baby gets.
There we
Got it?
go.
While the child is being, developed also after birth, so it's the mother that needs the vitamin K. So she needs what? What she need vitamin K? How's she gonna get vitamin K? What's the number one thing for vitamin K? Green drink.
Well, I know that's
That's
right.
it. That's it. Green drinks. You got to get the green drinks, the chlorophyll, green drinks, spinach, land, and sea. Those are the things that we look at. So it's the mother that has to feed. Because remember, the mother is taking care of the baby, and that's
Yep.
the nurturing of the baby. The baby's immune system doesn't have immune system yet developed. So that's where the mother comes in. So that's important for women to breastfeed. That's why we encourage breastfeeding. So keep that in mind. Yeah.
Okay. All right. Karen up in the corner. Then we'll go back to the side. Karen, you there, buddy?
Oh, I found the foot chart. Y'all want to see the
all
foot
right.
chart? I
All
got
right.
the foot chart.
Hey, while are you getting the flip chart up, Karen? Bring it
I
on.
got the foot chart. I
Well,
found it, big.
Well,
Go ahead.
actually, Bill, before I ask my question,
Yeah.
I want to see if Dr. Paul can answer this question in the chat. What are your thoughts about every person wearing Crocs?
Oh man, let me think, bro. You said Crocs, right? I did hear you right?
Yeah, Crocs.
Yeah, the question says, what are your thoughts about every person wearing Crocs?
Okay. All right.
Don't laugh.
This is a loaded question. This is a loaded question for me.
That's a trick
All right.
question.
This is a trick question. I know he set me up somewhere. I'm trying to figure out what he set me up with first.
No. It's just a question in the
All
chat. Then if we talk about feet,
All right.
so.
All right. I'm going to tell y'all a little story about how Crocs came about. All right. There's a history about Crocs. And the story goes, and I'm paraphrasing, of course, when they were talking about, we were just talking about this the other day. That's why I'm laughing. They were talking about how to dumb down society. Okay. And they said, well, when we're dumbing down society, a lot of it has to do with the way they're wearing clothes because we want to take their energy, we want to be able to dumb them down. So they came up with a design for shoes. And guess what those shoes designs were?
Crocs.
That's exactly what they were. Now, here's the wild part. When they bought it through and they thought about it, they said, they will never wear this stuff. That's what they determined. They said they will never wear this stuff. And guess what?
That's what they want.
They put it out anyway. And guess what? People are wearing it like crazy.
Yep.
And paying a lot of money for them.
People
and
are
paying a
laissez.
lot of money. Yep, absolutely. And a lot of it, it's some funny stuff that goes with that. I think you need to find shoes that are comfortable for everything that you are doing in your life. Got it? So take your shoes off, touch the Mother Earth, because when you ground yourself,
Amen.
you start to get back in touch polarity wise with the planet, Mother Earth itself. That means vibration, frequency, energy, everything. I think the Crocs are a major distraction for you connecting with Mother Earth. And the more you get disconnected, the more you get disconnected spiritually. I believe that. I truly believe that. So I say that take the Crocs off. That's what I say. I got these these socks that I was trying out, and they're grounding socks. I don't even have them down here. Yeah, they got these grounding socks, and I've been trying them out. And you can wear them around your house, and it helps to ground you wherever you are. And it works. I mean, this stuff really feels good, and it really makes you feel like your body gets your weight. It starts to deal with, with flat feet, all those things with arches, that falling arches, all of those things. So you want to just make sure, I'm not a Croc person. I never was for them. I know the story about what they were trying to do with them. I would say it's been a fad, and that's basically all I have to say about it, really.
Dr. Paul said he's not getting himself in there.
You won't see Doc with a pair of Crocs on.
Won't see me either.
Well,
You're not me, because it's disconnected me. That's why it's too. No, I would never do that. Yeah.
Okay, I wasn't trying to set you up, Dr. Paul. You know I wouldn't do that.
Yes, you would, Karen. Yes, you would, Karen. I'm just kidding.
But Karen, I would. You know what? That's a great question because I would love to hear it too. But anyway, but listen, I want to be Karen before you had a question also. You had a question.
Yeah, you did.
Yeah, but go ahead. I'll come in after you. Go ahead.
Okay, I just want to show this story. We call this the story shoes tell. The story shoes tell. Got it? All right, let me show this. Let me see if I can bring this up. I'm going to bring this up. These are some of our holistic health books that we use, and I want to share this with. I thought I may have mentioned this before. I never showed this, Big B. I never showed this to you.
I
never
don't
showed
know.
this to the family. I don't know. Okay,
Right. You bring it up, and I'll tell you what I do.
Right, it's been if so, it's been a while. So let me do that. All right, here we go. Can you see it?
Oh yeah. Go ahead. Yep.
Okay. All right. So the story shoes tell. So when the areas that you see in your shoes, I want everybody to start checking your shoes. All right. Check your shoes. Check your shoes. Check your shoes. You got a good pair of shoes. Take your shoes off. Everybody take one shoe off, and then look at it. Take one shoe off. All right. If you can see, we can diagnose what's happening looking at what's going on with your shoes.
Where you wear your shoes.
Yep, we can assess the shoes. See, shoes diagnose are where the shoes is worn out is where we put more of our weight on, right?
Yes.
So the inside, for example, the inside, if it's worn out, problems with intestines, sex organs. Wow, that's pretty deep. Yeah, that's deep because a lot of pressure is on the inside or the inside part of the body. On the outside is worn out. That's gallbladder, liver problem, outside of the body. Got it? Toe. You know how some people wear out the front of the toe always?
Mm-hmm.
Yeah. Always in a hurry. Neurotic. My grandma used to say something like that. She said, they used to have a saying back. My grandma used to say that. She said when somebody's shoes used to pull up like this, you ever see anybody's shoes where they poke up like this? Anybody got shoes?
Yeah, man. Yeah, boy.
And he said, you always in a hurry. That's what that means. That means that they got an old saying down south. They said you're going to be rich one day because you always moving. You always got something going on. And in the heel part, you know how you used to get taps on the front and the taps on the back? Y'all remember that? The steel taps? The steel taps?
I do.
Yeah, you remember that? Don't do that no more, right? Well, the heel worn out is kidney problems, lower back aches. Think about that. Think about this. Just think about it, okay? All right, going down the line.
There you go with your feet.
Here they go. Here's the feet. See, this is the normal position of your feet. So when you I want you to lay on your back or lay in your bed, right? Try to get on a flat floor, but if it's too hard on a flat floor, get on the bed, okay? Have somebody look at your feet. Put your heels together right here and just let it go. This is the normal degree of your feet. Normal position, ideal condition of the feet. The hip sockets are balanced and are at the legs or at the shoulders length, right there. So they should match the shoulder length. Got it? Y'all see this? Can y'all see this, by the way? Y'all can see it?
That you can.
All right, so now if you're doing the same thing, heels together. All right, take a snapshot of this if y'all have to. Take a snapshot. Right here. Look, the left foot is turned out more than 60 degrees in this example, 90 degrees. This indicates that the left hip socket is loose.
Ouch.
Ooh, that hip is out.
Good.
The left leg is shorter or more weight is put on the left foot. Sometimes that tendon up in that area is too tight. Yep. So you got to make sure you get an adjustment. Dr. Lenny does all this stuff, matter of fact, because we were talking about this not too long ago. So on the other side, the right leg, same thing as the left side, turned out more than 60 degrees indicates that the right hip socket is loose. Okay, so the right leg is shorter or more weight is put on the right foot. And then, of course, if you got both of them out like that, y'all, if you see anybody like this, you know what's going on. Both feet are turned out more than 60 degrees. That's an indication of both hip sockets are loose. Ain't that deep? That's some deep stuff.
Wow.
Yep.
What's
So
this
put your
website, Dr. Paul?
This
Sorry.
isn't a website. These are our this is our holistic health data that we use from our charts that we
Okay.
use. So yep, these are it. Now,
Let me butt in, Dr. Paul. Make sure you send me that so
yep,
that I can put it
yep,
in this
yep.
week's chat information.
Yeah,
Okay.
it goes into deep. We go into depth with, these 75 to 80-degree angles, and it tells a little bit about how your feet sit up and things like that. These are how we can see a lot of this has a lot to do with the way we're walking though. See, we're walking. You ever see somebody walk like this? Somebody walk like this or this side, favor one side versus other side.
Yeah, yeah,
That's why
yeah.
it's important for you to move your left and your right shoulders with your walking. Got it? When you walk, you should be walking like this. Got it? Because that's where your balance is from your left to your right. That's why you move when your left foot goes forward. What's your right hand doing? Going
Going
forward.
backwards.
Got it? Got it? So, like this, right? Okay. When you're walking forward, right? You should be in nice balance because if you're not, that's where your balance is thrown off. So keep that in mind. All right. Good stuff. Good stuff.
Yeah, Dr. Paul, excuse me. I was at a physical therapy, this is Saritha, for something else, and they had, you know how they do the examination? They
Mm-hmm.
said, do you know one of your legs are longer than the other? I said, what? And
Mm-hmm.
so thank God that they didn't tell me the angle it was on, but they were able to slightly every day do something to pull it out of
Mm-hmm.
my hip. I think it was my right leg was caught up in my hip.
Mm.
Like,
Yeah, yeah.
what?
Yeah, that's
And
it.
they had to gradually pull it out, but they had, bending the knee back and to the chest and just leaning on it and just until it just evened itself out. So
Yeah, yeah.
it's
See a
it's
lot.
a real thing.
Yeah, it's very real. And it could be based on the way we sit in our favorite chair, the way you
Yeah.
drive, the way you got your lean on when you at your favorite spot, whatever you're doing, it can throw it off. That's why it's important to get a good walk in the morning. And when you're walking straight with your head up, right? Head up, chin up, and walking with your head forward so you can get those muscles loose. Stretching, you're doing dynamic stretching in the very intro, right? Everybody know what dynamic stretching is, right? Dynamic stretching is movement stretches, right? And then when you've gone through your routine, you always want to cool down with static stretching. That means whole stretching, right? Everybody know what we're talking about? Got it? Static stretching, because those things are important and you can tighten up. Those areas of the hip are very, very important. So age has nothing to do with it, y'all. The age has nothing to do with it. We got children that have the same problems as adults. Okay.
Sedentary is terrible.
Yes, it is. You got to get it moving. That's right. Thank you, Serena. Appreciate you. All right.
Appreciate
Who
you.
else we got you now? Who else we
All
got
right.
there, Big B?
All right.
Well-
Karen, we got to finish.
Well, I never got started, but
Okay.
but okay. But okay. Hey, Dr. Paul, I'm looking at my shoes, man, and I'm so glad I'm not on the inside.
Yeah.
From your description, they're on the outside.
Yeah, that's right. You're on the outside. That's right. You're on the outside. So what's the outside? Remember, what did we say on the outside? The outside is what? That's
Well,
gallbladder, liver, right?
Oh,
So you got to
gallbladder,
make
liver.
sure. Yep, that's gallbladder, liver. Yep. He said you're so glad to be on the inside.
Yeah, you said sex organs were on the inside. I'm like, the bullet
It's a
there.
mellow ass, boy. What are you talking about?
But anyway, that's just some humor, South Florida.
But now you're gonna be.
Show.
But now
It's a
you're gonna
family
be.
show.
But now, lady, now everybody gonna be checking them shoes. Hey, honey, let me see your shoes, honey. Let me see your shoes.
Let me see the other shoe.
All right, so let me get to my question and get back to serious here. So, so in the situation of stage 4 renal kidney failure,
Wow.
any suggestions on that? I was talking to a fraternity brother this weekend, and that came up, and I said, I'll ask that question for you and send you the replay of the answer.
Yeah, yeah. The first thing I'm going to say is water. You know that.
Yeah.
Did you ask him that question? Is that the first question you asked him?
Well, that's always the first thing. The water. I sent him sample. I keep those bottles of water bottled at the source on my phone, and I just text them or email them out to people. So we had discussion about that. But you said on this weekend's program, Sunday's program, you and Bill, and you said it takes a long time to get to a certain point, and then once it gets to a certain point, then people want to do something about it.
Yeah, you got it.
And it takes a while to, if anything can be done, to get out of that. So I just said I would ask, stage 4 renal kidney failure, if anything can be done.
Yeah. It's all based on, them making the decision to want to get well. This is where, Karen, you're seeing where this is the world I walk in every day.
Right.
When I'm trying to help people get to understand that, look, stop playing with this. You got to start doing something. It doesn't have to be everything but do something. Start with your water. That's why I say master your water first. I give them the challenge now. Give me 2 days that you can do your body weight, half your body weight in ounces. Give me 2 days out of 7 days. The rest of the days, just try to come close. But give me 2 solid days. And I'm telling you, everybody I've ever put that challenge out has come back and said, wow, something happened to me. I do feel clear. I feel calm. My central nervous system is better. I slept better. Something went better for them. So you got to give them those top 10 toxic foods because it's usually the food choices they're eating. You know what it is, man. It's the same routine.
Right.
Some of the things that I give them that's sort of easy to get a hold of is something like celery juice. Celery juice is very, very important. You can use celery to help with getting the kidneys cranked up really fast. They can get really cranked up fast. So not to diagnose street kill, prevent disease, just food for the soul, just celery, but make sure it's organic, of course. Okay, make sure you cut it. I would cut the base off of most of them because I'm finding a lot of these celeries, you got to watch the sprays and stuff. But you do baking soda, aluminum free. And I would try to get a lot of celery juice in. That would be something that could really help them like immediately. Okay. There are herbal things right there, but they would need an assessment. They can always call me for assessments. I do international assessments every day. I got people calling from all over the country and even the world. So if they want to call in and have an assessment 1-on-1, I do phone consultations, usually about 9 in the morning, starts 9 to 10, somewhere around there. In the morning, I'm on the phone call every morning. So 1-877-377-2854. So are they in Florida?
Yes, they are. I believe they are. Yes. And I did mention Zoom consultations, phone consultation, but that was just in discussion. But I will put it out. I'll put it into text form, and whether email or text message or whatever. And then that's all I can do is we discussed 2 weeks ago.
And here's what I would say. We have to realize that the kidneys do so much more filtration than any part of the body that it is now being under attack because of the processed foods. Got it? So all of the things that they use to keep on the shelf longer so that people can buy it, all that stuff and process the bioengineerings. See, this is all about awareness. See, there's so many people that are just eating for taste. Or, we're eating with unawareness of what's happening. You know what they do? Remember what they do? They say, just put a whole lot of sugar in it, a whole lot of salt in it, and a whole lot of grease in it. And then they're going to love it. And I said, man, that's how they get you. They get you with that. So you got to take control of your taste buds, but know the difference. Get some knowledge under your belt. Okay, so that's where we start. But do your best, man. Do your best.
Yeah, I'll pass along this info. And then lastly, Sunday you talk, and man, it's amazing. I had this discussion last week about the mame sapote.
Oh, yeah.
And then I happened to tune in on Sunday and you said, I have a fruit for you guys. I have a fruit. And you meant Mame Sapote. And I went, wait a minute.
What? That's it.
That is in the back of you?
So I went out and got it yesterday, or no, I went out Monday and got it, and there it is in my backdrop.
That is right there.
Yes.
He's growing in his backyard.
You growing it in your backyard, man. Hold up. Let me see that. Hold
What
up.
is it?
Let me get in here. Hold up. Let me put that in spotlight for everybody to see. Yeah, that's it.
That's it, right?
That's it.
Have
That's
mercy.
it. Mame Sapote. Yes, that is one of the best things that you can get. How many seeds did you have? Because sometimes you can find more than one.
There's 2 seeds, one in each half.
Okay.
Those are the 2 seeds there.
Right.
And
Yeah.
man, I
spell
went
Mame
and
Sapote.
bought those until mine grows on the trees. It could be a few years before mine grow, but
Right. And it's it's based on, of course, the environment. Of course, we would have a hard time growing it here.
right.
And because it's a tropical fruit, but it's one of the best things. It tastes like sweet potato pie, man.
Yeah.
I mean, it's so
Sweet
delicious.
potato, pumpkin.
Sweet potato, pumpkin,
Right.
a little bit of
Pumpkin, the whole 9 yards,
it's
man.
like nutmeg. It's
Yes.
like all this like explosion happening in your mouth.
Yes.
And the thing about it, y'all, what I love, see how the inside of that, you can take a spoon and literally scoop it up like it becomes its own bowl.
Oh, ouch.
It becomes its own bowl.
Man, that makes
It
my mouth
does.
water.
Isn't that awesome, man? And you pull this thing off the tree, and this thing is good for everything, y'all. When
Yeah,
I
what's
tell
it
you
called?
this is Mame Sapote.
Mame Sapote.
How do you spell that?
Mamey Sapote. SAP is in
P-O-T-E.
Paul, OTE.
Yes.
Yes.
And where do you get it?
Well, most of it's grown in the tropical regions. So you would have to go to a culture store up here, but they get them in the stores up here. If you have a culture store around you, you would definitely go into those places and you'll find it. Yep.
Or go down and go down and get it from Kerry out of his backyard.
Yeah, Cam.
Yeah.
Ship us some.
Well, that'd be about 10 years from now.
You know I had to go there, right?
We coming.
This one that went to a Mexican supermarket, but we have the Mexican, Jamaican, we have all the things down here, so they're easy to get down here. But but I have 2 more, and they ripen real quick. So you're right, man. Use as a bowl.
Oh my goodness!
And eat them things, man. It's like sweet potato, pumpkin, and
oh
it's
my
sweet.
God! It's
and,
like it's a whole lot going on, ain't it?
Yes.
And you know what? Let me tell you why it's so good, y'all.
Why?
On the list of those things, we say fruit in the morning because fruit stimulates. Vegetables in the afternoon because vegetables stabilize. Got it? So you don't want to eat fruits and vegetables at the same time. Never mix fruits and vegetables together. How about that? All right? This is perfect for digestive in the morning because what cycle are you in when the circadian rhythm? You're in the circadian rhythm of what? You're in the circadian rhythm cycle of what? Intake. Remember? Not intake, I'm sorry, cleansing. You're in the cleansing cycle. So as you're cleansing, this is a perfect fruit in the morning for digestive, to get your digestive enzymes ready for the entire day. So that's why Mame Sapote is actually good for so many things, especially digestion. It's very, very good. Very high in folate. Now, a lot of things don't have folate. Folate is the precursor that they turn the terfolic acid, which is dealing with the central nervous system. So it's a balancer. It's a natural balancer of the magnesium in the body. It's the central nervous system. And of course, when women are having children, the first thing they want to get that folic acid up, right? But this is actually the original formation of that. It's the folate, which is very rare with stuff. And it's highest in this Mame Sapote. It is highest in there. So that means this thing is good for anxiety. It's good for stress. High in copper. Copper is what, Big B? What we say copper is good for? What's copper
hair
good
growth.
for?
Make it grow hair.
Hair growth.
Make it grow hair, yo.
Until your hair black back to black.
Not too many you're going to find that are high in copper, but it's high in copper. Also, B6 and vitamin C. This thing is packed, man. You got that in your backyard? Is that what you're growing in the backyard?
Well, I had the tree planted. I went to a nursery last year and bought one, and I was introduced to it, told about it by a phlebotomist when I donate blood, and they were all excited about it. So I went to a nursery and bought a plant or a tree, and finally had it put in the ground. Took it out of the pot.
Yeah, yeah, excellent. Also, that while you just mentioned that, that's excellent for regenerating the blood after you give blood.
Can you spell it again?
Meme, Mamey, sapote, SAPOTECA, right? Yeah, sapote. Yeah.
Yes.
Thank you.
And where do
So
you get it in the Philadelphia area?
you can get it in any culture stores, any of the culture stores.
Like a Jamaican
stores. You can find it mostly in places like where did I find mine? I found mine in matter of fact, I was in one of the cultural stores out here. Actually, I was in Redner's on this one. I found this
What
one in
about
Redner's.
H Mart? Do the Asians sell it?
Yep, you'll find it there. H Mart, right on. You talking about the one on Shelton, right? Right there, you'll find it. Yep. You know, it's just such something that when you dive deeper with these fruits, they just are perfect for digestion. And, you know, right now we're having a lot of digestive issues because of these toxins and things that are in the food. So what a great compliment that helps you prevent things like constipation, you know, thinking with bowel issues, irritable bowel issues, if you got diverticulitis, all that stuff. This is the perfect one right here. Okay. All right. Let's see.
What just lastly, just real quick, I bagged up my bananas I showed you last week. I bagged those up to freeze them, and then this morning I pulled my avocados off the tree.
Ooh, I can't stand you.
Go ahead, man. That's what's up.
Oh my goodness. Look at them. They're beautiful.
You got a whole garden back there, man.
Hey, man, I grow my own stuff. So I'm getting ready to put another pineapple in the soil, the crown. That will take 2 years to produce pineapples. So, you know, but hey, that's all I have.
Well,
all
Karen,
right, let's give Karen a hand. Let's give Karen a hand over there.
Yeah, but
the green thumb.
Karen, you can't go nowhere, man. And just set up a separate room. I'm coming out, hang out with you.
Congratulations. That's a beautiful thing.
You're an example for all of us. We all should be doing something like that.
That's right.
Yeah. Keep it up.
So stay safe down there. You know, how's the weather down there in Florida right now? You're on mute. You're on mute.
Hot.
It's still hot out. Very in the 90s. So, but it's good.
But no issues with the storm, right? Any
No, thankfully it just stayed east of us over the water. So
good.
We're good.
All right. Good stuff. All right. Take care. Thank you, buddy. Appreciate you, man.
Okay, will do.
All right. Who else we got there, Big B?
I tell you, boy, see, that's just crazy. And by the way, Brenda on Facebook wanted to know where Karen lives. He's down there in Florida hiding from us.
They're gonna find you, Karen. They're gonna find you.
Okay. I'm sorry about that, man.
Just find.
You don't want to find Karen. We're gonna put you on the farm.
Well,
look for the Mamey sapote trees.
Well. All right, let me see. Let me go back to, let's say, Glory Kincaid. Glory, you there?
Yeah, I'm here.
All right, Glory, go ahead. You're up next. And then Ron.
All right. I have a question about 3 substances. Okay. I saw something online and they were talking about the cutting board between the wooden and the other one that a person got sick with the salmonella, one of those things because of the chicken, and they even though they bleached and washed it, and so they were selling the product, and I think they said it was a titanium cutting board. Have you heard of a titanium cutting board?
Well, yeah. There's different ones that are out there. Somebody go on mute. Make sure you go on mute. Somebody's on mute. Who's that?
That's
Somebody
Neetha.
Neetha. All right, Neetha. Where are you?
She's muted.
Okay.
No, it's not.
That's not Neetha. It's not Neetha.
That's not Neetha. Okay, who is that? Let's see. I think they're good now. I think we're good. Okay. Now, what was that again? Now, the cutting board.
a titanium cutting board, or what type of cutting board would not hold, what's the best cutting board or whatever?
Well, you know what? Here's the issue. They had a issue with, of course, the poultry or meats that when they got on wooden cutting
Yeah.
boards, and that probably would be the safest one. But the problem is they were not sanitizing them properly. That was the key. See, when you spread that, you can get any of the bacteria gets into the pores, and that's when the problem comes in. So you have to keep them clean and have them dry out really well. But most people don't have time to do that, the maintenance that comes with it. The other cutting boards, they may look like you ever see the other ones made out of, what is the other ones made out of, Big B?
Plastic.
They're like right.
Plastic,
It's a form of plastic. I wanted to
Yeah.
get the name of the cutting boards. They're the plastic. See, that's the one they're finding the microplastics on.
Yeah.
You remember we called the PFAS?
The PFAS.
Yeah, so don't use those. Don't use
Well,
those.
what about the titanium? This was someone saying, yeah, the wooden and the other one wasn't getting, that people were getting sick from that,
Yeah.
and they advertised their product titanium
Yeah,
cutting board. So are you
but
familiar with that?
yeah, but I mean, titanium is titanium.
Yeah, well, that's what I was wanting to find out about that.
Still, you're talking about metals, and you're using a metal knife, right, or a steel knife, and you're actually creating and you're putting it on a titanium board. So that's possibilities of getting into your food, especially with
Yeah,
metals.
it
I,
didn't
I
sound good to
I
me.
still say the best is the cutting boards that are wood cutting boards, but you have to maintenance them. That's the key. I don't mess with any of the other ones. I think the wooden is the best, and you should stick with the best. There
Well,
are some.
how do you clean the wooden one where you
Well,
don't get?
you can use baking soda, aluminum free. Baking soda clears that out. Also, you can spray it with thieves oil, believe it or not. Those things actually are good. So any of those, those oils that we talk about that are sanitizing herbs, like the clove oils, all those that works on cutting boards too. It kills the bacteria. Yeah. So I would watch that. I really, if you can send me, I can look at them. But I'm gonna tell you, I really don't get into any of the titanium. We already got an issue with titanium, titanium dioxide, which
Yeah.
is actually in a lot of products. So we got to watch that. I would just limit any metal connectivity because we are just exposed to too many metals already. So keep
All
that in
right.
mind. Good
All
question,
right.
though.
Well,
Good question.
yeah, thank you. Two more things. The copper bottle to drink, or cup. I have a copper cup, but I've been seeing I guess these algorithms come on your phone because of certain things. But I saw all this stuff about these copper and they containers they talked about the PFAT, the plastic and even the metal one, the stainless steel one, but they just talked really high on the copper, almost like that the copper can change the water, and give it. So how do you? I know you talked about copper before, and you expound on that again. Like they really, there was like, look, you got to get these copper cups. All of a sudden, I see all this stuff about copper. I do have a copper cup, but they was talk about the thermos, like you shouldn't even be drinking water from plastic. And I guess if you poured it in, so that's what the real question. If you poured it out of the plastic into the copper, is that going to change?
Okay, here's
the PFAS and all that stuff.
Yeah, because let
the
me help you with that, okay? Because you got to unpack that. Here's where I believe that's happening, and this is where I had to really break down what's really happening here. The problem that they're finding plastics in or plastics in the water has everything to do with, okay, it's in a plastic bottle. But if they're BPH, and usually on every bottle of water, remember I told y'all there's a date, right? There's a sell by date. Got it? And the sell by date on the bottle. Big B, you got a bottle with you that you can hold up for them? I don't have one in front
Right
of
here.
me.
Where's my?
If you hold it up, right? Let me put you on face there. Okay. Can you put one up? Put one up for me.
Sit right there.
Okay.
Hey, Dr. Paul, can you unpin me as well? Because people
Oh,
are
I'm
saying
sorry.
they-
I'm sorry. I didn't even know you were still pinned there, man.
Yeah,
You were
thank you.
spotlight then, buddy.
Okay, hey,
All right, go ahead, Big B.
thank you.
All right, can you see it?
Yep, there you go. Now, can you hold that up a little bit? Pull it back just a little bit. Do you see the date? There it is right there. See
It's
the
right
sell
there.
by right there. See it?
Yep.
Hold it up in an angle, like a little bit. The other way. The other way. Right
The other
there.
way.
Right there.
Right
Right
there.
there.
Okay.
See that right there? See that right there? What does that say? What date is that? That looks like 2027 on there.
Yeah. Mm-hmm.
When is that? 2 years from now. Got it? So what does that mean? It usually means that when people are testing these bottles for plastic, it's usually been exposed to either too much heat or what? They froze
Or they
them
froze the bottle.
or they froze them, and then
Mm-hmm.
that becomes it takes that date out of perspective. Usually
Yes.
when stuff leaves the factories, it's always what happens after that that's the problem.
Yes.
So that's why I'm saying if get in, whoever who's distributing your water for you, find out what days they're picking it up, be there so you can pick it up yourself directly when they drop it off. But I'm going to tell you that copper is probably one of your best vessels that you can use. Copper, when you're drinking the water, already a good alkaline water, and you put it in a copper vessel, you're getting a
Okay.
little bit of that copper ion. And that
Yes.
copper ion is for what? Circulation. That's for
Yeah.
circulation, y'all. That's what
Okay.
gets things moving. So that's
Mhm.
good for your veins, your arteries. That's for also thinking, helps you think faster. Yeah, the more copper you have in your brain, you think faster, y'all. And also, yeah, yeah, and of course, it grows hair. Yes, that's Big B always
Well,
says it grows
how
hair.
did you?
It moves hair and it turns hair that may have been white black again. So that's what the key is. Always, that's a circulation issue. When we raise that, you're getting a little bit of that copper ion. So that's what's good for helping the body raise its level of pH.
Dr.
Okay.
Paul,
All
also
right.
talk about the downside of the copper vessels. Like when I bought mine, I bought the one you recommended, and it was good quality, and it's a little costly, but it's worth it. There was a brochure that came with it,
Mm-hmm. Yeah.
telling you not to like to cure the water, like pour it in there, put your crystal geyser water in there, let it sit for a while so it can absorb the copper.
Mm-hmm.
But drink it in that day. Don't let it sit there and try to drink it 3 days
Right.
later.
Right. You can't leave in copper the way you would leave. That's why usually the copper vessels, you'll see the pictures that are open, the air open. So when you're closing them up, you're usually closing them up so that you don't spill them. That's what those lids are for. But proper ways of doing it, see, copper can start to oxidize after a while. So at the very
Right.
bottom, when you finish them out, okay, when you wash out for the day, you drink your water, you make sure it air dries. We flip them
Yeah.
over. We flip them over. That's what you
Uh-huh.
do. Got it? So flip it over and then put it like a towel or something underneath, and you just flip them and let them
Just let it
air
drain.
dry.
Mhm.
That's what you do. Because you're going to see they're going to, at the bottom, they're going to start to oxidize at the very bottom. So,
So
yeah.
when the oxidizers turn like green or something?
Yep, you got it.
Yep.
That's
Yeah.
right. That's it.
Like a mouse.
So
Okay.
it's
What?
not a bad thing, but it means
Yeah.
that it's the bottle's natural progression of what the bottle's starting to do. It's starting to tear down. But that's
Absolutely.
what it does. That means
Yeah.
you're getting some of the iron, that copper in your body. You got it? That's what's helping
Mhm.
it.
Yeah,
Okay.
it
Well, fine.
commands respect now. It
Hmm?
commands respect.
Yeah,
Yeah, it
All
yeah.
right.
does. Yeah,
What
it
you say?
does.
We got, you know what I always say? You got to respect it like electricity.
Well,
You can make yourself sick.
That's right.
Yeah.
That's right.
Okay, it's all about the balance. One final thing.
Yep.
And you talked earlier about these socks. I ordered some grounding sheets.
Mhm.
Haven't got them yet. I just ordered them, and it was like when you order these grounding sheets, you get some free socks with it.
Okay.
The socks with the grounding socks.
Okay.
So, do you have grounding sheets also?
No, I don't have
Or
the grounding sheets, but definitely
uh,
they work. They work. Because the reason why I'm going to tell you that they work because they're actually measuring them. They're taking meters and you can read it yourself. You can do the grounding yourself. You got a meter. Did y'all see the one person that was on? There's plenty of things on YouTube that show you how to measure grounding. Let me see here. So you can see the difference between somebody, like for example, they'll take off, they'll be standing in their shoes, right? The regular
Yeah.
sneakers or shoes, and then they'll measure themselves. They have a grounding, the polarity charge grounders. And you can see where their polarity is 0. The next thing you know, they put their feet on the ground, that thing goes sky high. It's amazing.
Yeah, they
So-
go in the grass as opposed to being on the cement. I've seen that. There's one that they showed a little kid is standing on concrete, and then when they step over into the grass, it shows that it goes up. So the aspect of grounding is to be touching the earth, not the concrete jungle, the cement that most of us are in. We got to get the sun, we got to touch the ground, we got to hug the tree. And since we live the way we do, when I heard about the grounding sheets, I said maybe I'll try that. So maybe I can give y'all feedback on after I get them.
They all work. Yes. Give us some feedback on that. Okay. Thanks a lot.
Okay.
Appreciate you.
All right, thank you.
Let me
All
show
right,
y'all
now.
real quickly about this thing called grounding. Can y'all see that, Big B?
Yep.
Can you see
Got
that?
you. Mhm.
Okay. Let me show you that. All right. Here's just a real quick snippet I grabbed real fast. This one right here. This one.
I want to show you something interesting. Look, I have a simple voltmeter here. One is in the ground, the minus, and the plus I have here. And now I'm wearing shoes, sort of. Yeah, I'm not connected with the ground. I touch the red pin. Does it say? 1 or sometimes 0. And look, when I touch my feet with my feet the ground, what happens?
Woo!
Whoa! Look at that.
Up.
Wow.
Y'all see that? Look at that.
Think about it. When you wear shoes. That's why I don't do it anymore. Cheers.
Cheers, everybody.
You see that? Did you see that?
Wow.
That makes a big difference, doesn't it? That makes
now you know why I'm hugging trees all the time.
Yeah, now you see right
I'm
there.
praying it's gonna make me grow hair. I know it ain't working, but I'm
Now,
gonna try.
my question to everyone that's listening: when was the last time you touched Mother Earth?
This past weekend.
Yes, yesterday.
Right, kick the shoes
Like an
off.
arboretum farm.
Yesterday.
Yep, that's
All
right.
right.
Go out in your backyard, grab that, put your feet in the dirt. That's right. Ground yourself.
We got all these supplies, put a little bed.
Now,
right.
it works even better. It works even better
Mhm.
when you stand in the sun.
That's
Got
right.
it? When you stand in the sun. Yep, stand in the sun while you're standing in the dirt. That charges you even better. So keep that in mind.
Florida, when his wife
All right. So Ron, just mute yourself. You're coming back feedback there, buddy. Okay. But just
where the Ethiopians and Africans are doing relay races, they run barefoot in their practice, and they barely look like they're wearing shoes when they are doing the Olympics. They race and practice barefooted.
Yeah, you know what? It gets also the muscles and the tendons in your feet strong again.
Yes, indeed.
You know, sometimes when you're wearing shoes, it stops your foot from development when you're moving in the balance and the coordination and things. So that's right. Kick the shoes off. That's why children love to kick their shoes off all the time.
Yes, my grandkids.
They kick the shoes off. They used to tell me that was a problem with me when I was little, right? They used to say they said they would have me in the stroller and they had to go in like 3 or 4 stores to find my clothes. They find a shoe in Woolworths. Another shoe.
Man. What can I tell you?
They look down there and I had no shoes and no socks on. People looking like, what's wrong with your baby?
Just a free spirit. That's all. Just a free spirit. That's all.
Just a free spirit. That's it. That was it. That was it.
Okay. Doc,
Okay.
before we're
All right.
going to run over, you said something a little earlier about the thieves wall. Now, Cheryl asked the question about thieves wall. She'll know, can you use it on your clothes or on your skin?
Yes, you can. Yes, you can.
Okay.
Thieves oil is an essential oil, and with that, there are carrier oils. With the formula, it is a carrier oil with it. So it's a combination of those five essential oils. If you want that formula, go to my website, drpaulherbs.com. Go under downloads and look for Ultimate Herbal Formulas, and at the very bottom, you'll see it. It'll be the Thieves Oil formula, okay? And it'll have all the ones, and it'll show you how to put that together, okay?
You got it. All right. Ron DeSant, you're next, my man.
All right. How you all doing tonight?
Doing
All
well,
right,
brother.
Ron, what's up, buddy?
All right. I just wanted to let you know I went to Dr. Lenny on Monday, and I'm going back on Thursday to get my results.
All right.
So it was really, they put me on the machine to measure my feet. And also, one of the good things, they offered me Crystal Geyser water.
All right now, Doc. Where's Doc at? Is Doc in here tonight?
I haven't seen him tonight. Hey, remember, he still got those pallets, boys, so you can pick him up.
Yeah.
He's there. Doc's
He's
there.
He's in. What's up, Doc?
What's happening?
Doc still got his pallet, so picks him up. Boy.
Doc, I think you up to I think you up to your ears in Crystal Geyser right now.
I got pallet minus like 2 cases, Doc, but we still
There we go. All right. Well, I'll see you on Thursday. You can
Ron looks so happy.
Look forward to around.
Okay. Hey, doctor, have you heard this? Somebody came down with a plague.
Yeah.
What the heck is going on?
Yeah,
The
Black
world's
Death.
crazy.
Black Death ain't never went nowhere. There's
No,
always
it's always
somebody.
around.
Yeah, it's always somebody coming up with Black Death once a year. It never really officially left. It just in very low levels. But yeah, they found Black Death. Didn't we announce that? I thought I announced that one.
Yeah.
Black
Yeah,
Death.
you did.
Yeah, Black Death a couple of weeks. It was about a month ago. They came up with Black Death. Y'all know what Black Death is, right? That's the Black Plague. The bubonic plague. The bubonic plague. The very thing that hit in around the 14th century. And that's the one that we talk about the thieves oil was generated from. That's where it came from. That was the fix for that, for those that knew. They used the thieves oil, which was the thieves that were robbing the areas that were quarantined by Black Death. They actually were going in and stealing their diamond jewels and money and everything. And they were like, how are they doing this? How are they doing this? And they're not getting sick. Well, they said, we're going to have to catch one of them. So, of course, somebody got caught. They brought him in, said, whoa, how did you do it? Matter of fact, we'll let you go if you just tell us how you did it. They said, well, we're perfume experts. We're herbalists. We take this combination of herbs and we put it in a concoction. We spray it in a mask, spray it over our body, and it protects us from bacteria, virus, fungus, parasites, and all that other stuff. They said, wow. And then they told him, after he told them, they still hung him anyway. They hung him anyway. But anyway, that story goes, that's what thieves oil comes from. Got it? So it deals with the pneumonic plague and the issues with what's happening with the lungs. So, yep, Ron, it's out. Yep.
Yeah. And one other thing I heard too, the shrimp was contaminated with, Jesus.
Radioactive.
I
keep telling y'all.
What the heck is going on in the world with everything? So should we be looking out for other items we use? I don't use shrimp, but I just saw that. And I'm like, what the heck is going on?
Yeah, right. So if just to bring y'all up to scoop, we didn't announce this, but definitely Walmart. Did y'all hear about this, by the way? Did y'all hear this on the news yesterday?
I did.
Yeah, just yesterday.
Yeah. Walmart actually recalled their shrimp, specifically that was out of Walmart because it was radioactive contamination. Yeah, did y'all think
light up?
I keep telling y'all. I'm just telling y'all. I know y'all tired of me telling y'all about the shrimp and the stuff, and I keep telling y'all it's some stuff that's on the bottom. Remember, everything hits the bottom. Got
Always.
it? Anything
yes, sir,
that's the worst of the worst of the worst hits the bottom. So you don't want to eat from the bottom or anything that's living that's eating
In
off
the
the
bottom.
bottom. You got it? Because what's happening, whatever they are eating and you eating them is what you're gonna be getting. You got it?
And
So
you can be
now
at the bottom.
they took it another step up and called it radioactive. So that means when they turn off the light, you're gonna be
You've
glowing.
been glowing.
That's us. We're
Yup.
gonna be going.
Your
Glow.
teeth gonna be glowing. They're gonna be like saying, Girl, you just came from the dentist, didn't you?
Like you're in a
You eat some
sci-fi
shrimp.
movie.
Man.
Came back from eating
You
shrimp.
have
Half
you
a pound.
you gonna be glowing, man. So you leave it
Straight.
alone. I keep
Yeah.
telling y'all, God told y'all to leave it alone a long time
Yeah, he
ago.
did.
All right,
Yeah, he
God
did.
told
That's
y'all to leave it alone a long time ago. And
told
then
me that
that's when
15
I
years
saw it,
ago.
my son said that to me and was cracking up. He said, Dad, you gotta go believe this. I looked at it and about 5 other people sent it to me. I said, Yep. I keep telling y'all, leave that shrimp alone.
Hmm.
Yep.
Told me that 15
So
years
Okay.
ago. Now
And
listen.
the last thing I wanted to say, my eyes are still doing great. I'm still using the St. Christopher Eye Bright
mm.
wash and everything. No more
No more
floaters.
floaters, huh? Good.
No,
Oh wow.
nothing. So it
Oh,
really works.
all right,
All
man.
right. See, that's
Let's
all
give
stealth.
that's a
See,
stealth,
it's all
that's a
stealth.
stealth testimony. Give
Stealth
Rod a
testimony.
hand, y'all. Come on, y'all. Come on. Let's
Great.
give
That's
him a
great,
on.
Ron.
hand.
Congrats, brother. Yeah,
Congratulations,
man.
Yay,
Ron.
Thank you, thank
congratulations,
you.
Yeah,
Jerome.
Good
buddy.
stuff,
Congratulations.
man. Good stuff. Good
Excited
stuff.
to hear.
Yeah,
That's
that's
good,
All
good
man.
right.
stuff. You know what? You know what? You know what? What? Just kind of veggie backing off of
Oh, yeah.
this shrimp thing. You notice they never said where did it come from? Where
Yeah.
did the
Nobody says a word, man.
radioactive stuff come from? So just keep your eyes and ears open, and with that, they're telling you for a reason, y'all. Stay away from that stuff and watch everything. Read labels, stay on point. Okay? All right.
Yep.
Great.
All
Thanks.
right.
Thank you,
Is
Ron.
that it,
Appreciate
Ron?
you,
Thank
buddy.
you.
All right,
All right.
Marche, you're next.
Marche.
Marche. There you go.
Hello, everyone. Hello. I'm super excited
Habia.
because I'm super excited because I got my big cousin Rashida on the line with us. She's a nurse, an educational nurse at Penn. So I just want to shout her out because
All
she didn't
right.
want to
What's
All
her name,
right.
put
Shout
her
Marche?
out to
face to the
Rashida.
camera. Yes.
Rashida. All right, Rashida, glad to have you.
Yes. Shout out.
And then Dr. Paul, I found my best friend used to be your he used to be your mailman for many years. He said he was your neighbor. That's one of my
What?
favorite friends. Yeah, Ronald.
What? What?
Ronald.
Mm-hmm.
Yes.
Mm-hmm.
Oh
Yeah.
wow. Small world. Small world.
Mm-hmm.
And getting
Yeah, it's
smaller,
very
buddy.
small. Very, very.
That's why you better treat everybody right, y'all. Do you know
Because
it?
you
If you
never
don't know
know,
who
buddy.
Mm-hmm.
You never know,
Yes,
man.
But
yes.
this weekend I was at Wayne Avenue store for like four times in a row, and I live in West Philadelphia because I was so determined to
Mm.
get everything I needed. So I was able to get that lymphatic droplet for
Mm-hmm.
me to do 3 times a day, 30 drops at a time.
Mm-hmm.
Then I bought the thyroid tonic.
Mm.
But I have a really bad UTI, and they want to prescribe me, or they did prescribe me antibiotics. And then they had to prescribe me the antibiotics for the yeast infection because if I take the antibiotic for the urine tract infection, then I'm going to get a yeast infection automatically that's been going on since I was 14,
Mm.
on and off. So I haven't had a urine tract infection like maybe in about 10 years now. But
Mm.
what can I do for this urine tract infection? Then I have an appointment with you this Monday. Then I have a follow-up appointment with you September the 13th. So I got a
Mm-hmm.
lot going on.
Right. First of all, I would say watch your food choices. Watch
Mm-hmm.
any yeast in general. Watch any sugar. You got to watch your sugar. All the
Okay.
stuff that we talk about all the time. You've heard me go through this with you, and in the family. Um, Refined sugar, refined salt, refined oil, all those acidic things,
Mm-hmm.
fermentation. You got to stay away from all those things. See, that's what yeast thrives in fermentation. You got it?
Mm-hmm.
That's what literally fermentation is part of. It's fermentation tearing down or breaking down. So watch out for also hydrogenization, things that are hydrogenated. Watch those the
Coffee
peanut
creamers.
butters, the creamers, yeah, all that stuff. You got to watch all that. You know what to do. I would just say, the traditionally used, and that's why when you come in, we'll fine tune it. But just for the family that's listening, when we're looking for natural antibiotics, we're looking for things like what? We're looking for,
Real.
yep, capsule form. You got the golden seal root. You got also the um you got a couple of things that I'm trying to think of how
Echinacea.
you can tackle both of them. Tea
I got
tree
the
oil,
clover. I got
clove.
clover.
Yeah, clove is good too, but I'm
Mm-hmm.
trying to see something that you can. Oregon grape. Oregon grape is a good one. See, Oregon grape is going to have a little bit of the berberine in there.
Mm-hmm.
Also barberry. Yep, that's a
Okay.
little bit better. And it's kind of in between the golden seal and the Oregon grape. So
Excuse me.
barberry.
Excuse me
Barb
for 1 second. I don't want to confuse you. I don't have a yeast infection. If I take the antibiotics for the urine tract infection, it's going to give me a yeast infection.
Well, that's what I'm saying. That's because you're using probably not those pharmaceutical
Mm-hmm.
antibiotics. That's the difference. That's the
I don't
difference.
want to use it, but I think I have to use it because my urine tract infection got me like laying down.
Well, that's what I'm saying. That's my whole point. So
Mm-hmm.
when you're using the natural ones, that's why I'm saying the barberry. That's what the
Mm-hmm.
barberry is for. See, the
Okay.
barberry will make sure that that's a natural antibiotic. It's not as potent as the golden seal roots and not as light as the Oregon, but it's right in the middle. That's the one that we sort of go in between. So it's barberry, Barberry. Got it?
Okay, I got it.
Barberry.
I wrote it down.
Yep. That
Okay.
one
Uber
may
Earthy works great too.
Uva ursi is good also. That's urinary, and that's for the whole uterine tract. That can help also. But the barberry works in that family is a little bit more intense. So that one could be more effective. So that's the one we'll look at when you come in, okay? We'll look at your numbers to be sure.
Okay.
All
All
right.
righty. Thank you for your time.
All
All
right.
right.
Thank you.
Paul, the other thing that doctors don't tell patients is when you take an antibiotic, it also alters your GI flora because you're killing the
Exactly.
bacteria in your gut as well.
Exactly. You're killing everything. So
I
that's
know
why.
that's why I didn't want to take it, but it got
Yeah.
me like laying down, not so I got to take it because I don't feel well. And I
Right.
was at Wayne Avenue and they didn't have anything at the moment, so
That's
I
why
had to
we
take it.
That's why we look at the barberry. That's
Okay.
exactly why. Because you're sort of caught between things. One causes remember, it's killing everything when you take a
Mm-hmm.
Yeah.
pharmaceutical.
Mm-hmm.
And plus, they know that the antibiotics are not working. They're just knocking it down a little bit.
Amen.
We got super
Exactly.
bugs now. We got
That's
super
right.
bugs. We got these super
Super
bugs
bugs are
that are
kicking
resistant.
everything in the fanny, man.
I mean, they won't work. They'll last about a few days and then they come right on back in. So
Yes, sir.
barberry, I think people are missing it on that one. And
Mm-hmm.
don't sleep on that barberry. I think that's one people forgot about. They went to the golden seal or the uva ursi or the Oregon grape, but the barberry, that's a good one right there. Might
What
want to
about
get
the Bucci, Dr. Paul?
Buchu also. Buchu it has a different effect for it, but it is a anti-inflammatory and it's also antibacterial also. Very good. Yes, it is Buchu
Okay.
is good too in that same family. I would say yes. Um, but in situations when you're dealing with that yeast and making sure you don't get a yeast infection and all that and keeping things, see, barberry does an impressive thing because it keeps things in the pH balance, the culture of the pH very balanced, and
Right.
that's what makes it it's very dynamic in that way. So So keep that in mind, all right? Because those little berries on the barberry are very acidic. They're acidic, sharply
Right.
acidic, but they're sharply acidic in a way that helps the body balance out that pH. So keep that in mind, okay?
Dr. Paul, excuse me, do you want to speak to the feces causing the UI? Like if you have diarrhea and you don't wipe too well, bacteria, things like that, it can cause a
Yeah,
UI.
well, yeah, you got to watch that. But
Possibly.
most of it's possible, yep. But the number one thing I tell folks is make sure you're not holding your urine.
Urine,
Got it?
yes,
You're holding
exactly.
your
Hmm.
urine. Holding the urine can be very much of a biggest problem. And I get it, ladies, I get it because
Yep.
I get it. You ain't got to
Hmm.
explain it to me.
Yep.
When the man's driving, or you got a significant driving, and you say, I gotta go, and they say, oh, we're gonna wait till we get home. You say, no, I gotta go right now. I
Right
get it.
now.
I'm pulling over for you because I know. Because what you gotta do, you gotta let it go. You can't hold on to this. Got
But
it? When
Dr.
you
Paul, it's not just that, because I tell my patients all the time when they have problems with incontinence, they say, well, because we will be multitasking, get that
mm,
first urge to go and suppress it because we're in the
mm,
That
middle of doing something.
that's right.
that's
Yep,
right.
And
that's
then we
right.
get that second urge and we suppress it. Next thing you know, we reposition ourselves and we're doing a pee pee dance to the bathroom.
Did you pee pee dance? That's right.
Yep.
Yeah, that's
The
right.
international dance.
The
Yep.
international dance pee
Yep.
pee dance. Now, remember, also, I would say for everyone, this is male and female. Put that app on your phone. That app I was telling y'all about. You remember I told you about that?
Yeah.
The bathroom app.
Bathroom app.
Yeah.
Yep.
I'm gonna tell you, every week I get a story, I get a testimony almost every week on that bathroom app. If you don't know what I'm talking about, go to your app store and you download the bathroom app. Okay? Bathroom, just punch in bathroom app or bathroom finder. Okay? And I want you to download one of those and keep it on your phone. See, they GPS, the bathroom finders GPS right to where you're located. So that means that if you got to go, you need somewhere where you can GPS and say, what's the closest bathroom to me right now? Click it and it'll tell you. It'll give you ratings on what it is. Where is it? There's one called We Can't Wait. They got Flush Toilet Finder,
Well, all right now.
Squat or Not,
Well,
Poop Mat,
all I do is
Lulu. Lulu.
well.
Y'all got it. So put one of those on there. I'm gonna tell you, it'll save you. I'm gonna tell you. Because sometimes you use that and you need to find somewhere and it'll have ratings on, what the best ones are. So if there's ones that are close to you, but they may not have good ratings, you'll know, all right, don't go there. And sometimes they'll even have special instructions in there. Like saying, when you go into this store, ask for the manager, he'll give you the key, and you go in there, it'll give you specific information on it. Excellent tool. Excellent. And it was designed for those that were diabetic during the COVID because a lot of people weren't using the bathrooms. Of course, the COVID, had to be up to par. So utilize those apps and keep it on your phone. Okay. All right, Big B, what
Okay.
you
All
got,
right, Dr.
buddy?
P, we've got two more and we're at 9:08. We've got
All
Summer,
right.
then is it Blessed Are You?
Blessed are you.
Hey guys, so just a quick question, Dr. Paul. I was perusing your website and you talked a little bit about this earlier today, but I saw at the top you now have Forever Chemicals and you have a protocol to detox.
Yep.
Yes, ma'am.
And
Yep.
I looked at it, it is pretty extensive. Some of this stuff, I'm like, where would we find a lot of these items? And do you take them in a pill form or like liquid form or you know what I mean? Because like phase one, like do you do that day one or is that
Yeah,
you
I
do that
would. You
for
didn't? Did
30
you listen?
days?
Did you listen to last week's show that we
No, I
talked about?
missed
No.
it.
So you want to go back to last week's show? So I did break it
Okay.
down. Okay,
Oh,
you got to
okay.
go in.
All
So
right.
I did go down and I broke down how you get it, what
Okay.
forms you can get it, and you can get
Okay.
it in different forms and variations. Okay,
All
so
right.
definitely I would point you back there because I get into the weeds with it. But here's the thing: remember, this is food, so you can't mess it up. So
Okay.
whatever form you can get it in, just get it moving. The
Okay.
extensivity of is because you have to keep the level of intensity. When you're dealing with bacteria, virus, fungus, parasites, or any thing that you're trying to move out of the system, it has to be, you got to be intentional about it. So that's why it's in those 5 phases, on those phases
Okay.
that we talk about. So you have to, so back to back, even if you're doing just a little bit of it, don't worry about it. If you can't get it all in one spot, don't worry about it. Just do the best you can to get it in the best forms. They come in powders. We got in different forms. Contact your herbal store. They'll get it for you. Or
Okay.
most of herbal stores will have exactly what's there. So the bentonite clays that we talk about,
Mm-hmm.
any of those things that we talked about that were in there. Of course, you got the green drink, my colon cleanse, my parasite
Mm-hmm.
formula. You got a lot of good things in there that you can get. Always call the stores, and they should be able to help you out. Wayne Avenue Health will be able to help you with that. Okay.
Okay. All
And
right.
by the way, I put that Wayne Avenue's address in the chat, guys.
But
Okay. And
check last week's show. That's what we
so I
did.
have to get
Okay.
that from you, Bill, last week's show?
Yeah,
Or
yeah,
okay.
yeah. I'll put all the at the end. I'll tell you how to get all this information, and then you'll be able to
Okay.
get everything. Okay.
Go to
Okay.
YouTube as well. It's on
Yeah,
YouTube.
it's
Yeah,
already
Go
on
to
YouTube.
YouTube.
It's already
yeah.
on YouTube. It's
It's
already
already
on.
on
okay.
YouTube.
Yeah, last
Okay.
week's program is already on there. Yeah.
Okay, perfect.
Mm-hmm.
Thank you.
Because I give all that information out in the chat, the links to both Facebook and the YouTube. Okay.
Okay, perfect. Thank you.
All
All
right, not
right.
a
Good
problem.
stuff. Good
All
stuff.
right, bless all of you. You're the last one of 9/11. Bless that. Talk to us.
Good night, Dr. Paul. Good night, everyone.
Good night.
Good night.
I just have one question. What's a good pillow to purchase?
A good pillow.
Want to
Ooh.
put you to sleep.
Guess what the best pillow is? The best pillow is the best pillow for you.
I know that's right.
That was an easy answer.
That was easy. That was the best question.
That was really easy.
That was the best question of the night. Blessed are you. That was the best question all night. Let me tell you. See, here's the reason why. See, when you're laying down, whether you're on your back, are you a back sleeper or a side sleeper? What do you say? Side sleeper?
Side sleeper, right.
Bless your heart. I'm a side sleeper too. That's my favorite side right here, like this. Yeah, just like
Left
this.
side or right side?
Left
Yeah,
side.
left or right. Yeah,
There's only one side, the left side.
No, I think on my back, like the dead people. I'm sorry. I learned that when I was in the Army. Because remember, I was a pathology assistant, right?
Yes.
Doing autopsies. So I learned they look so peaceful. I learned how to sleep on my back.
You like you enjoy it too, right? Yeah.
You have no idea.
So here's the thing, and if Dr. Lenny is on, he could probably definitely
No,
answer.
he just left.
He left out. Okay.
Yep.
See, what's happening is your spine. The key is to keep your spine straight. You got
Yes,
it.
indeed.
And you don't want to. If you're side sleeping, of course you got to have. You should have a lumbar pillow if you're having lower back issues. That goes between your legs. But your head can't go too flat, so you don't want a flat pillow, and you don't want a too fluffy pillow that's too high. You want to keep the head level that the spine is even, so that when you're laying to the side, you're not, either too high or too low.
Okay.
And that's the difference right there. That's the, the guy, the pillow. What's the guy that does all the pillows?
Oh, he's a Trump
Pillow
man.
man.
Yeah, he's a Trump dude. I mean,
Mr. My Pillow.
Don't mention him.
I know. I don't want to mention him.
I actually have his pillows, but that was before all the foolishness. But I currently have those.
When you throw the pillow back at him, right? So the concept was, it's interesting because I heard his story before all the foolishness. Also, he had that story, the same thing that you're saying. He was having problems with his neck, just like a lot of people. So just make sure you get a pillow
Give me about
that's
10 minutes.
it is not too flat and not too high. You got it.
Right.
So the key is to keep your spine straight as possible. Because especially if you're a side sleeper. Now, did y'all know what side to sleep on? Which is the best side to sleep on if you're a side sleeper?
I thought
The left side.
Your left side. Your left side is your best side. Yep. The left side is the digestive side. You will digest your food better if you lay on your left side. That's the side. So, but that's what I would do. Find a good pillow. Memory foams don't work for me. I don't know why. They don't work for me. A lot of people, it works for them, but it doesn't work for me.
I have a family member that swears by his bamboo pillow.
Yeah, there's a lot of them. That's why, pillows are like shoes. You got everybody has their
Has a different, yeah,
specialty.
man. And that's
I
true.
that's why I tell people, just go to, a pillow store and just, try them out, lay down. You try to keep that head straight though.
Got it.
That's the
Okay.
key. All
Thank you.
right. All right.
All right,
Sounds
that's
good.
it,
Paul,
Dr.
can
B.
I ask you a quick question?
Sure,
Sure.
Rob. That's Robin.
Instead of peanut butter, I've been getting sunflower seed butter. Is that better?
Yeah, just make sure. Have you looked at the ingredients in there? Sunflower. Is any remember, no hydrogenization.
Let me check.
Okay. And what's the name of your brand? Is it the organic sun butter?
It's
Man.
Is there's
sun butter.
sun butter? Yeah, a lot of people buy the sun butter. Yeah, the sunflower butter. Which one you got? The organic or the no sugar added?
No stir, nut free.
Nut free, no sugar,
No stir.
no
Nut
stir.
free.
No stir, nut free. No stir, nut free. No, I don't have that one.
Got
Yeah.
oil on the top or something?
It has sugar.
Yeah. This one does have sugar.
Yeah.
So just what the keywords are looking for hydrogenization. If you have issues with, it's still thick no matter what. It's still thick. So if you're having issues with blood pressure, you got to be careful, okay? Be careful with any type of thickness, thick, creamy things that pour slow.
Okay.
Got it? So if it's try not to do it all the time. Now, this one, that brand, though, is pretty good. Usually that's non-GMO. It's actually plant-based. It's vegetarian. It's all got all the clicks on there. So they're aware of what's going on. They're not going to give you something like hydrogenization. They're usually, now they do say roasted sunflower seeds.
Yes,
and that's
roasted sunflower seeds, sugar, mono, and diglycerides.
Yeah, I don't see that one there. Yeah. So I would just say, watch your pressure when you're doing that. You have any pressure issues?
No.
Okay, any diabetes at all?
No.
Okay, so you should be good. Just drink plenty of water, okay? Make sure you drink plenty of water. Yep. All right. Sounds good. Thank you.
Buddy.
Appreciate you.
We are done, buddy. Everybody's
We are
man.
done. We are done,
yo.
Big B. Time flies, man. Let me tell you, time flies. All right, Big B, tell them how they can be a part of the family tree and support us with this venture. And I will encourage y'all, please, if you got anything you want to donate to us to keep this thing going, do y'all think this is worth anything? Did you learn anything out of this? Yes. Come on. We want to keep it going. So Big B over there is doing a great job. He's taking the information, he's putting it on Facebook, and he's also updating and editing and putting on YouTube. Give him a blessing today, all right? So I want to reach out. So Big B, tell them how they can be a part of the family tree and be a blessing to us, all right?
As always, my friend, listen, guys, in order to make sure you got a copy. Oh, by the way, before you go with that, Dr. Make sure you send me the feet chart so I can include it in this week's chat, okay?
All right.
All right, guys. See, guys, I got to put his foot to the fire to make sure you handle his business. All right, guys, again, make sure you get a copy of that chat. You got to do what? You got to send me an email. Send me an email to Mecca that's Bill Morgan, meccavideo@gmail.com. Again, meccavideo@gmail.com. Now, to continue to support the family tree, you want to do what? You want to use my Cash App. That's $BILMORGAN. Again, that's $BILMORGAN. If you use your bank, you donate to your bank, that number there, that ID number is meccavideo@comcast.net. Again, meccavideo@comcast.net. Of course, we have what? We got P.O. Box right here in Mullica Hill, guys. You do what? Send to Bill Morgan, P.O. Box 191, Mullica Hill, New Jersey, 08062. Again, that's Bill Morgan, P.O. Box 191, Mullica Hill, New Jersey, 08062. Do what? Bring your friends, bring enemies, bring family, bring what? Bring everybody right here. Wait to the family.
All right. Did you learn anything tonight, y'all? Put your hands together.
Yes.
Put your hands together. Yeah. Hey. All right. I want to thank everybody for chiming in. And remember, we are a greater program because you showed up. So we thank you so much for your time and hanging in there. And you know what? We don't charge you with anything, but just, tell the truth. So go out there, share the information, be a part of the healing community, be the one in your rotation. Tell your family what to do. Let's give a shout out for our host with the most, Big B, Bill 1L Morgan. Hey. All right. We said keep it up, y'all. Make sure y'all stay on point. God bless y'all. May God keep y'all. And remember, if you're breathing, you gotta shine. God bless you guys. All right. Come on. Y'all gotta put your hands together. Come on. Tap. Come on down. I see you, Marcy. Marcy got me, Big B. You on me now. What's up, Miss Marcy? Come on.
Queen of the basement.
Oh, here go my friend here. Here's Django. What's up, Django? Django? He got a little big, didn't he?
Who wants to tap too?
Boy, hey, Django getting big, Doc.
Yeah, he want to tap for a bone. That's what he wants to tap for. Come on down. Tap. Come on.
Hey, Barbara, make sure you send me an email and ask that question, Barbara. Make sure we'll get it back to you.
Is that Lisa in here? My wife Lisa's in here.
Lisa's
She's
in there.
peeping in here.
Lisa, don't be playing that.
Lisa? What's up, Lisa?
Lisa's in the back, hanging in the back.
She's in there listening. All right. Tap.
Ryan's in the back, too.
On the inside. Good. Tap. Come on. Tap. Come on, the left side.
Grandma Judy's in the house, too.
Good, that's right.
Katrina's in the house.
I want you to take your fist like this. Take your fist like this. And I want you to put it in your back right here.
Ooh,
and then rub them like this.
I do that every morning.
Just rub them up and down like this. Rub them like this. See right there? That's for your kidneys right there. That gets your kidneys right. Right, Django? Right, Django said, yeah. Django is on my back right now. Okay, Django. He's on my back right now. Django. Down, boy.
That'll teach you. I'll get you. You messing with me.
Oh, my goodness. He got me good. Somebody let him out. That's Jaron did that. I'm going to get him. He let the gate out. All right. Come on.
Who let the dogs out?
He let the dog out.
Who let the dog out?
So Django know when the show's over, he ready to get a bone. That's right. Tap.
Yeah, buddy.
Come on. Get that. Come on. That's right.
His circadian rhythm works real well.
I'm telling you, he showed up. And he got excellent hips, too. All right, and bring it on down. That's right. Bring that energy. That's good for inflammation. Little qigong going on. Yeah, that's right. Over your knees. In the area you got any pain. Clap. Get that energy going with good intentions, right?
Yeah, buddy.
Keep your spirits up, y'all. Keep your mind right. Keep the negative energy and negative people out of your life, right? Did I say something? Did I just say something? Uh-oh. Keep the negative vampires out your life, right? There you go. Val, I see you, Val.
All right, come on,
All right, then come on down. One more time. Come on down. That's right. Go on the range. Yeah, there you go. Come on down.
Go ahead.
For inflammation. Good. Bring it on down. Good. Y'all feeling good? Ooh, you feel it. You gotta feel it. One more time. Clap, and rub. Clap and rub. Clap. Get that heat going. And then the last one. Clap and stop. And keep that top one. Keep that bottom one still. Move that top one. You feel that? Try to do like that. You feel your hands moving. You feel like you got something in your hands. Like a ball of energy. Take that ball of energy with good intentions. Bless yourself. God bless y'all. May God keep y'all. And thanks for tuning in to the family tree.
Bless everybody.
All right, bless y'all. Big B, where we gonna be on the weekend, buddy? Where we gonna be on the weekend?
Check me out right now, 6.1 FM 900 AM Black Talk Media, WRD Radio, right here.
Yeah. We'll see y'all.
On Sunday, catch Dr. P on the health program.
All right. That's right. All right. We're gonna do a countdown. 10.
Yep.
9.
I heard that.
8. 7.
Well,
6.
I heard that.
5.
Go now.
4.
Right now.
3. 2.
Go ahead.
And 1. God bless y'all. We'll see y'all next weekend on the radio on the weekend.
9 a.m.
Yeah, right. That's right.
Everybody be well.
Be well. All right, Tommy. I see you over there, Tommy. All right.
Get it, Marcy.
Marcy. Go ahead, Rita. Go Rita. Go Marcy. Go Paulette. Go Carol. Go Tommy.
Thomas, y'all don't be playing.
That's right. Shout out to our Facebook fam. Thanks for tuning in.
Yeah.
We're here every Wednesday, 7 p.m. Got it?
Yeah,
we'll see y'all. God bless y'all. We'll see y'all later.
My cousin Jean is on here.
Yeah.
Hey.
That's right.
All right, Big B. We'll see you, buddy.
Yeah, man.